Good morning. Am I audible? Great. Good morning to everyone. I welcome you all on the question answer sessions. We will start our session with the prayer and then we will have a recap of last question answer sessions and then we will continue today's question answer sessions with all of you.
हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मन विजय करे, दूसरों की जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, दूसरों के जैसे पहले खुद को जय करे। हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर,
Good morning. We're giving tribute to a great man, Dr. Samuel Hahnemann, for this divine science and who taught us dare to be wise. Seeking blessings from our Guru, Dr. Praful Vijayakar sirs, who made this science with the combinations of modern science and made homeopathy easy like mathematics. Special thanks to one of my inspirations and mentor, Dr. Jitesh Sosalia sirs. I am in the field of homeopathy because of this man. So thank you, sir. A great thank you to my mentor, guide, guru, and friends, Dr. Suketu Shastri. Because of these two men, I am on this platform of homeopathy to teach you all and learn from all of you. So thank you, Dr. Suketu sir, for guiding me and mentoring me. So sir always says that we are remembering sir that sir always says, I do not see what mind does not know. So first and foremost thing, we have to install something in our brain. Then and then we can see in front of us the patient is dealing with. So sir always says, install something in your mind. Unless and until something is not installed in your mind, then you cannot see if it is there in front of you also. So sir always says, I do not see what mind does not know. So this process of question answer sessions or this process of giving you idea, it is not of mine. It is all because of what Dr. Vijaykar has taught us, and this is what the path of sir. Sir always says, sharing is a caring. So I am here to share the things which I learned from predictive homeopathy, which I learned from the Dr. Vijaykar sirs, and if any mistake is happening, it is because of myself, it is not because of the predictive. But this is what something that I have to learn and relearn and then unlearn something which I learn mistakenly. So this is what sir always says, I do not see what mind does not know. So we are starting with the recap of the last question answer sessions. That in the last question answer sessions I have given you an idea about the approach to a different type of cases. So we will revising that again so that we will have an idea that how to approach each and every cases in our day-to-day practice. So unless and until we have an idea of such cases, then and then we can understood that how to approach certain cases. See, many a time a very young homeopath and a very learned homeopath both are learning, and the way that he learn, that gives you something that homeopathy is easy. So if a young homeopath can perceive a patient the same way the learned homeopath can perceive a patient. So this is what the bridging the gap between the learning process, and that is what Dr. Vijaykar has done by applying the modern science to the homeopathy, and that is what the Vijaykar sir gives us a gift as the science of homeopathy. So the approach to each and every case is very easy. So I am just recapping the old lectures. Already I have uploaded the question answer sessions on the YouTube channel. You can go through that and learn. I'm not going into detail of the whole last lectures, but I am just giving you a few glimpses or a recap of certain notes or certain points which is most important in our day-to-day practice. So how to approach a different cases. So many a time in a younger or a neophyte homeopath, there are the cases comes to us mostly the acute cases, the mostly the psoriatic cases, mostly the cases of a lower layer, that is the skin, that is a connective tissue, that is endoderm, GIT, or urinary or respiratory tract infections. When we are evolving in such a way that then the cases of the category has been changed, and then the cases of heart, cases of the lungs, cases of the liver, cases of diabetes, thyroids, and everything comes to us. And then finally, we have a cases of the hopeless cases, of a neurological cases, or sometimes a genetic mutated cases comes to us as a sort of giving relief to them. So this is what whenever we have came across a certain type of cases, how to deal with these cases. So most of time we have a compass, and that compass is given by Master Hahnemann. That in the discovery of homeopathy, which I found that the law of similia similibus is not so important. Rather than the important is the disease of chronic disease, the theory of chronic disease, which is the theory of miasm. So after giving this in 1828, Master Hahnemann said that if my contemporary follow the teaching of mine in this proper manner, then the result will be infinite. But I must doubt that they will not tried it, or sometime it is remain untried. It is written in the preface of the chronic disease. So if we know that how to approach different cases, then and then we can have idea. So the philosophy behind that is, if we know the destinations, so if we know the destination, then and then we can reach to the destination by route mapping and by finding the routes and the shortest reliable harmless route. So this is what we have to deal with in each and every cases. So many a time we came across three type of the illness, which we called as the illness of the physiological changes. So mostly the physiological changes comes and goes, comes and goes, comes and goes. So this is mostly the inflammatory changes happening in the body, comes and goes. This is purely a soric in nature. So this is what Master Hahnemann has given the idea that all the disease start with the inflammations, and it is start with the physiological changes, and physiological changes is because of body is trying to maintain the homeostasis. If this homeostasis is disturbed by a certain causes, it may be the physical, it may be the mental, it may be the medicinal or a drug induced, and then this physiology has been disturbed, and this physiology is giving rise to changes in the biochemistry or changes in the immune mechanism, giving rise to the inflammatory changes, and that is represent as irritations and the psora. So we have the psoric illness. When this irritations is continue, our body adapt to the homeostasis by making a changes at the level of the structures. Initially it is produces changes at the level of functions. If the functions is not taken care by, then it has to adapt the changes in the structure of the particular cells or the tissue, and in this the morphological changes is happening. So if we find the morphological changes happening for the process of growth, or process of consolidation, so process of thickening or process of the fortification, which we termed as psychosis, as mentioned by Hahnemann, that is the disease of condylomata. So condylomata is just a representation so that it is the growth process, and that is why we have termed it as the consolidations or fortifications or the thickening or the hardening. This is something which is happening at the structural level to protect the body, to maintain the homeostasis, and that is called the psychosis. And if the morphological changes is something which lead to the destructions of the particular tissues or a particular part of the body to save the whole, that is called as the syphilis, which is mentioned in the organon of medicines or the chronic disease by Hahnemann as the disease of the chancres or the ulcers. So ulcerations is something that the breach in the continuity of the cells or a tissues. So this is what something there is a breach. So if something is destructing, then we consider the miasm. So we came across these three types of the disease only, not more than that. So we have to find out what are the disease patient presenting to us, and that is something called as the psoric disease, the physiological one, the psychotic disease, the constructive disease, and the syphilitic disease, which we called as a destructive disease. So we have a compass of understanding that the disease have a three variant: the physiological, the constructive, and the destructive. So what we do, if we have again we have to divide the illness into two process, which we called as the acute disease and the chronic disease. So if we have a acute disease, mostly because of the physiological changes, that is a psora, and the another process which we called as the disease may land up into the death or something which is out of control, it is called the sorosyphilitic disorders. So we have came across the acute disease in two terms, that is a soric acute and a sorosyphilitic acute. In a soric acute, there is a inflammation is in a control and the physiology is maintaining, whereas in the sorosyphilitic, the physiopathology in which the inflammation is going out of control and either patient may land up with the emergency or either may patient land up with the death process. So the immediate intervention has to be done in these cases. Whereas the chronic cases has a two different variant, that is the pathological changes or the structural changes. The structural changes has to be a constructive pathology, the constructive pathology which we called as a psychosis, in which the tumor growth, anything which is excess, or the destructive pathology in which there is a necrosis or apolysis of the tissues or the cells. So this is what the chronic pathology. So we have this. So how to approach? So the school of predictive homeopathy teaches us that the we need to more emphasis is on the genetic trait. So if we understand the gene of the man, if we understand the man in the disease, not the disease in man, then and then we understand the genetic trait of the man, and then we apply the remedy which is according to the genetic trait, which Dr. Vijayakar has termed as a genetic constitutional similum. It is not a different term, but it is something that we have to understand this. So if we apply these medicines to the patient, then and then reversal is possible, otherwise it is not. So the only Hering's law is seen by this way. So according to Master Hahnemann, the aphorism number 5 says that in acute disease, the exciting cause is the most important, and in a chronic disease, the fundamental cause is the most important. So, in a chronic disease, what we have to consider? In a chronic disease, we have to consider the physical constitutions of the patient, his character, his moral and intellectual character, his occupations, his mode of living, his social and domestic relationship, his age and sexual functions, etc., has to be considered into the case. So this is something chronic case, whereas
आगे पर होगा अच्छा लगा
in acute cases, we just need to understand that we need to find out the exciting cause. So the according to the predictive homeopathy, we have to have a chart of this. In acute cases, we need to find out the ailment from it is the most important. Then the miasm, it mostly the sora or the sorosyphilitic. In this, what we have to do, we have to understand what is the change after the disease has been started. That is called as a change disposition. Previously, the child was very cheerful, and suddenly the child become cranky and irritable after certain ailments. So this is something the change disposition. Previously, he was working well, and suddenly after the event, he become a dull or a super or a sleep overpowering. So this is something the change disposition. So in most of case of acute, you have to find out what has changed after the ailment has been started. So change disposition, in this case we have to use the acute chart. Dr. Vijayakar has made this chart for beautifully. Sir has written in the book that 70 to 80% of your cases has been treated with the acute chart. Rest 20% cases you have to go beyond and learn further something. What is the reaction of the patient during this acute complaint? So, and in that add the thermal and thrust. This is the most important aspect. So, in acute, you have to understand this process only. Whereas in chronic cases, the cause is not important as just the ailment. When the miasm has been changed from sora to psychosis, you have to understand the cause has to be gone into further process, so that the sensitivity goes into insecurity, insecurity goes into altered perception. So that is something which we called as a cause. So in that case, first and foremost process is to find out the miasm. Then, according to Sir, the finding out the basic disposition. The basic disposition, it is called as the innate characteristic of the patients, and that is a non-disease characteristic. When the patient having a trait or a reactions, every time the patient is reacting in such a way when he is in a stressful situation, that is his basic disposition. So this is what very important understanding, because this basic disposition is governed by their genes, and that is their genetic tendency. So we have to taken the genetic tendency at the level of psyche also and genetic tendency at the level of body also. So that has to be considered into this and add the thermal thrust into the case so that this will gives you a totality and that totality is helping you to understand the man, and that is what the chronic case is. So in chronic cases, you have to find out this. In acute cases, you have to find out this. This we have already learned in the last sessions. So to find out the GCS, which we called as a genetic constitutional simillimum, we need to understand the miasm first. So for that, you all are requested to read the source book, The End of My Assumptions to the Miasm. So it will guide you that how the miasm is represented into our body as well as in our day-to-day life. So it is a Sora psychosis and syphilis. So according to that miasm, we have a approach to the disease. So if we have a physiological or functional disorders which we termed as the inflammatory changes like a collar, rubor, tuber, dollar, infection, irritation, spasm, sensitivity, neuralgia, in this case do not require the GCS because it is based on the change dispositions and the acute remedy has to be prescribed. So mostly it is based on the chart of the acute. When we have pathological structural changes like a fortification, it can be hyperfortifications or hypo, so it is hyper or excess or less. So it can be accumulation excess, a proliferation excess, or a depositions or a synthesis. So in this we have to require a GCS, the genetic constitutional similum. In later slide I will give you how to select the GCS, so you will get the idea that this is most important in our approach to the case according to the miasm. And when we have destructive disorders like apoptosis or apolysis at the cellular mechanism or a necrosis or a gangrene at the cellular mechanism, so it is represent us in the form of either exaggeration, distortions, perversions, hysteria, destructions, autoimmunity, or the genetic mutation. This is something which we called as a syphilitic presentations of the genetic apparatus. So it is genetically exaggerated, genetically distortions, or sometimes goes into perversion. So in that state, you require two things. One is a GCS, or sometimes it is a PCS. It is called as a pathological constitutional simillimum, followed by genetic constitutional simillimum. So again, the question arises that what is the PCS and what is the GCS? In the later side, I will give you the difference of this and when to apply this into a case. So according to the disease, so first and foremost, what we have to find out in physiological changes, if we have any disease of inflammatory changes, so we need to find out the cause. The cause is a SORA. Okay, then it is ailment from, and according to ailment from and the reactions of the patients, we prescribe the remedy which is acute in the state. It is because of change disposition. So here the GCS is not required. Again, in a pathological, the cause has to be find out. The cause means what? The fear or the perception. So whenever the construction is happen, so the cell is so much so fragile or insecure that I need to protect myself, and for that protection I have some insecurity and fear, and that fear has to be find out in the cases, and that is the in the form of perception. So in that case you required a GCS, the genetic constitutional simillimum. And the third process which we called as a destruction, here you need to find out the cause which is out of control, and that is what you have to understand. So here cause is also important. So here the sensitivity in inflammation, the sensitivity is there. In fortifications, the insecurity is there, and in destruction it is out of control reactions as a cause. So you need to find out the cause which is out of control. So anything which is out of control as the level of emotions, at the level of intellect, or at the level of perceptions, that has to be find out and that has to be taken into consideration for the prescription. So in that case you require a GCS or sometime a state remedy followed by a GCS. So this is what the approach to the case in short. Now what is to prescribe GCS, what we need? So to prescribe the GCS we need to take a case taking, and for case taking we need to understand what is the need and sensitivity of the individual. So if we understand the basic need according to the Maslow's theories, the basic need of the every individual is The physiological need is the food, air, water, and the sex, and followed by the psychological need, which we called as the safety, belonging, or love, or respect. And then it is the transcendental or the self-actualization. So this is what hierarchy of the need. So we need to understand the patient is coming into which need. So for example, if we have a calcarea patient in front of us. So what is the basic need of the Calcaria? Calcaria need is the safety and security. So he want the shells, he want the home, he want the shelters. So initially this need is fulfilled with the shelters and everything. Then Calcaria feel again insecure that I need to earn more money, 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 and that is what they started collecting the money. After getting so money and everything, he feels insecure that I must be punished, so I need to have a religious belief and I need to go to the God for the safety and security. So this is what something the need also evolved. So we need to understand the need of the constitutions, and according to that need we need to prescribe a remedy. So for GCS we need to understand the need and the sensitivity of individual. For more detail on the need and sensitivity, I must recommend all of the learner to go to the Happy Gujarat YouTube channel, and there is a playlist on the need and sensitivity. I had taken the 4 lectures on the need and sensitivity in details. So you go to that lecture series and then understand in a proper way. The second part of the prescription to the GCS is the disposition. The disposition is the most important part of practice. So according to Master Hahnemann in aphorism number 210 to 230, he has mentioned everything about the disposition. So disposition is the chief guide in the prescriptions of the medicine. So this position is most important in each and every cases. And again, you have to understand that the change disposition, particularly in acute cases, and the basic disposition or innate disposition in a chronic cases, that has to be taken into consideration. In one footnote also it was written that you cannot prescribe Nux vomica to the calm and cool persons, or aconite to the calm and cool person. It is contraindicated. So same way the disposition is the most important part in our prescription. And then the syphilitic symptoms or the altered perceptions, that is the most important aspect when you have evolved to a certain disease, that you when you have came across the disease of the syphilitic variant. In that case you have to understand the syphilitic mind, and the perception related to that has to be taken into consideration. So for prescription of GCS you need these three things into case. Again, for a dispositions learning, we have a series of lectures in the Happy Gujarat YouTube channel. So you can go through the Happy Gujarat YouTube channel and learn dispositions in detail in the 6 series of lectures. So I had taken that in that YouTube video. So go through that and you can understand in a better way. Now we understood the GCS. What is the GCS and what is the PCS? This also taken in the last session also. Again, I am recapping this. The GCS it is called as a genetic constitutional simillimum, and the PCS, which we have termed as a pathological constitutional simillimum, which we called as a state remedy, which we called as the emergency remedy, which we called as the acute remedy for a particular state. So that is what pathological constitutional simillimum. So in considering the GCS, what Dr. Praful Vijayakar sir has taught, that to understand the GCS, to understand the gene of the patient, we have to understand the gene. It is expressive genes or inexpressive genes. According to that, their behavior also, their intellect so to be like that. So we have to understand the extrovertedness or introvertedness of the patients. Then the gene has to have a control over everything. So this is the wish of the gene. So we have to understand the will of the persons, the either a positive will or a negative will. The intellect, so intellect has a good intellect or a bad intellect. The moral, good or bad moral. Then the sensitivity of that particular individuals. Then the emotional reactions. So each and every time the emotional reaction is based on their genetic tendency. So sometimes the person's having a weeping tendency, the emotions is weeping, always weeping because of slightest cause. So that is what their emotional reaction. Some may go into the violence, so that is because of their genetic tendency. So that is what we have to consider in the emotional reaction. Attachment to the persons, attachment to the part, attachment to the things, attachment to the monies and everything. So that has to be counted into consideration. Then the physical generals. The particulars, generals like a thermal, thirst, aversion, desire, discharge, and the physical particular, all these are to be considered into the GCS. This is something which we call as a Kentian totality, mental generals, and physical particulars. So this is what GCS. What is the PCS? The conceptions of the PCS can be taught in a destructive life-threatening disease like a autoimmune disease and the cancer. So whenever the cell has gone mad or whenever the immune system has gone impaired, at that time you can understand the pathological constitutional simillimum. So in that case, you have to understand the autoimmune disease need to be probed the cause and effect phenomena. So here what was the cause which lead to the autoimmunity and the effect which is the autoimmune process. So here in autoimmune cases you need to understand the cause and effect phenomena. So what was the autoimmune process? The autoimmune process, it is called as a destructive process. That means the self destruction, the gun is toward the self and the persons or immune system attacking the self. So here the cause must be autoimmune or the destructive, that has to be counted into considerations. Again, the effect in the form of which part or which area of the particular uh, part of the body or a tissue is affected or what was the pathology is involved, that has to be taken into consideration as the effect. So here the sphere of action is the most important, the pathology is most important, or tissue involved is most important. So here which we called as the Boger Boning Hussein's or Boning Hussein's approach, that is the treating the pathology with the cause and effect phenomena. Again, the third point is also consider the reactions after the autoimmune disease at the level of mind or at the level of body also. So most of time the mental syphilitic emotional reactions leading to the end of the life and which is called death. So most of time the person is thinking about the death, person is going toward the destructive modes, or person is trying to have a commit suicide. These are something which we called as a destructive death related syphilitic emotional reactions, and that has to be taken into consideration. So in most of the cases of the autoimmune disease, what we learn from Dr. Vijayakar sir, that always thought that death desire, that means a person is gradually going toward the death. It is something, it is desiring death. It is a syphilitic reactions of the autoimmunity. So most of time in whenever you didn't get any of the rubric from the patients, you can directly enter through one of the rubric. It is the death desire, then the sphere of actions, and then the emotional reactions of the particular patients, which is destructive toward the self, that has to be taken into consideration, and then you can prescribe the PCS to the patient. So this is what very important aspect of understanding when you are dealing with the autoimmune cases or a genetic mutations or a cancer cases. So how to go into entry point? Entry point in the fast destructive autoimmune process or gradual. So what we have to do? So we have to understand the false perception which lead to the autoimmune process at the mental level. That means what was the false perception lead to the autoimmune process? That means the autoimmunity. That means destructing the self. So there are certain false perception related to the guilt, that I have not done proper way, I have committed something, I have done the wrong things, and that is going into the destructive process at the level of cellular mechanism, that has to be taken into considerations. The second point is the affinity of the organs or the sphere of actions, that has to be taken into consideration. And the third point, that is the syphilitic emotional reactions, mostly the death desire, mostly the post autoimmune disease, that has to be can consider. Again, when the autoimmunity get reversed after the pathological constitutional simillimum, then consider the basic sensitivity of the individual, the soric need, the innate dispositions, and the sphere of action for the genetic constitutional simillimum. So most of time the PCS is in relation to the GCS also. So that has to be taken into consideration. So this is something you have to learn and evolve. Also, this was written by the Master Hahnemann in aphorism number 177. When you have a disease which is in a zigzag cure, you must require a several antisoric remedy in succession to deal with the case. So that is what several antisoric remedy. That means sometime you require this PCS, sometime another PCS, sometime another PCS, and then finally the GCS. So you have a 3-4 remedies in succession, and then you get the proper cure according to the Herring's law of cure. So this is also written by Master Hahnemann in our Organon of Medicines. Hope you all understood about the concept of the GCS and PCS. So today we are starting with our question answer sessions from this point of view. So this is the recap of our last sessions. So many of you are having a great questions, and I will try my best to give you the best of your answers, and what I learned from predictive homeopathy, what I learned from my mentors and everyone. So I'm just giving you a brief idea, and this is something that you can do not take hard and fast rule, but you have to experience this and apply into your practice, so that you will get some new clue. So every time what I used to learn, that is learn from our own experience, and after that learning I have to apply something into it. So this is what I am giving you an idea about the certain questions. So we will starting with the question answer sessions. Are you all ready? Up till now it is just what we called as the recap of the last sessions. Great. So we will have a little interactions in case, so that I will give you a certain brief idea. So question answer sessions. In last sessions we have completed the 10 questions of the delegates. In these sessions I will try to cover up as maximum as the cases, and there are a few questions which I have left because I need to take whole sessions on one question. That's why I have not taken that into this session, question answer session. But we will have a next month sessions on question answer, so we will take that into next month session. So the questions from one of the student from the Surat. uh, After the first prescription, if there is any new symptoms develop, should we consider it for the second prescriptions? Many a time you have the same questions in your clinical practice also. For example, he had given a case, the case of anxiety neurosis. First, there is no any suicidal thoughts, and after the first prescription, it developed. So, can we consider it for the second prescriptions? Anyone have a guess or idea about this? How, if you have this type of question, what could be your thought process? Then I will share the answer with all of you. Please write in the chat box, or you can unmute yourself and share your views also. Yes, miasm has been shift. We need to consider the case. Yes, absolutely. Yes, very important. It may be the suppressed anxiety can be suppressed and need to change the remedy. Absolutely. So your learning process in the right way. That is what I want. That the question answer sessions gives you a clue that your learning is in the right directions. So absolutely all are great. So first and first, if the new symptoms after the first prescription is more dangerous according to the compass of miasm, then it must be considered and prescribe the right similimum. This is what all you have answered. The second here, the anxiety neurosis, mostly the sorosyphilitic in nature. Yes, absolutely. GCS has not been given. Absolutely. The remedy is not touching to the core of the patient or not touching to the genes. That's why the symptom has been advanced to the this process. So here in anxiety neurosis, it is mostly the sorosyphilitic in nature or exaggerated. And what happened here, the patient in psychiatry, it is said that if the person having a thought of the death or a suicide, then it is in a psychiatric illness, it is called as a warning signs. So here in this case, it is the suicidal thoughts patient put into the syphilitic state. So here disease has been traveled, the miasm has been traveled to the higher level. So in that we have to consider that the miasm is gone up. So the suicidal thought is most important in the case, and that is what the syphilis in the case. So here in second prescription, we need to consider the suicidal thought as one of the entry point, because this is what the highest syphilis ending toward the death or going toward the death or leading to destruction of the self, that has to be taken into consideration. So by just looking into questions, you have an idea that you all are in the right learning process, that what we have to do. So many a time this type of patient comes to us. So if we have the compass of miasm, so we can evaluate the symptoms in terms of miasm, and then we have to prescribe according to that, because it is going toward the dangerous or the death towards. So this is very important. So hope Dr. Manar has learned something from this. So going toward the description, must consider it and prescribe according to this. So GCS is yes, absolutely. The another questions by the same doctor. He is one of my student in our Surat. So he said how to select the PCS. Already I have mentioned in the sessions what should consider and what not. Uh, some guidance. For example, in hypothyroidism case with an anti-TPO more than 1,000, the only complaint in the pain in the calves, burning soles, and the weakness. यस डॉक्टर विमल कुमार, जैसे कोई भी डिजीज डायनेमिक इन्फ्लुएंस से होती है, बॉडी में मेंटर करती है, वैसे ही माइजम भी डायनेमिक होता है. देन आर डायनेमिक इम्प्योरिटीज माइजम लाइक अ काम, क्रोध, लोभ, मोह. यस, हाउ टू स्टडी सोरिक, साइकोटिक एंड सिफिलिटिक rubric. We will have a session on that, Dr. Vijay. For that, you will first understand the miasm in a better term. You read, Dr. Vijay, you read Sir's book of End of My Assumption of the Miasm. Again, I have a reading session, daily reading sessions in the morning. So already I had completed the book End of My Assumptions. You go to the YouTube channel, Dr. Amit Gohel, Satyam Homeopathy, where you have a playlist of this book. You go to that book, watch that video, read that book, and you can have an idea that how to apply the soric rubric, how to apply the psychotic rubric and the syphilitic rubric in the case. So you will get that idea in that sessions. So, for example, hypothyroidism with the case of anti-TPO is more than 1,000. Learning pathophysiology of the disease will surely help to learn the miasm of the rubric. Then differentiate will be easy. Yes, absolutely. But for that, the basic understanding is needed, Dr. Nisha. So I must request Dr. Vijay to understand the miasm from the base, and then you can go gradually. Okay. So everyone are evolving this process of learning. Even I myself also evolving with the learning and teaching to all of you. So this is what I learned from all of you also. So what we do in this case, as per the thought process, if we have a hypothyroidism, see most of time we have this type of hypothyroidism patient comes to us, anti-TPO is high, and this is one-sided disease. Only the pain in the calf or burning soles or a weakness, or sometime subclinical autoimmune hypothyroidisms or autoimmune thyroiditis is there with the more than 1,000 anti-TPO, and patient have no symptoms. What do in this case? Many a time you came across this type of cases. So again, the concept, Dr. Manar, I have explained the concept of the GCS in PCS in previous slide. So hope you got that how to find out the PCS. Again, in hypothyroidism with anti-TPO positive, it is indicative of that autoimmunity means the destruction of the thyroid with the auto antibodies. So that is what the part is going to destroy to save the whole. Okay, what allopath must do in this case, they must prescribe the levothyroxine or the thyroxine tablet to the patient so that the body's uh, homeostasis mechanism is maintained without the thyroid, and gradually the thyroid getting destroyed. So that is what happening. But what we have to do, that we have to stimulate the thyroid and we have to make that autoimmunity reversal. So what for that, what we need to probe the autoimmunity in his life of the patient. So how the patient goes into autoimmune process. So entry of the case should be the autoimmune syphilitic rubric and the thyroid gland in general as a rubric entry point, along with the post-disease patient reaction according to its miasm. So this is what something that the hypothyroidism, which we called as a psychosis. But going toward the autoimmune process is called as psychosyphilitic. So the reaction has to be psychosyphilitic. That has to be find out from the patient. But in this case, we need to probe the autoimmunity in his life. Now the question is how to probe the autoimmunity in life. So today's session is mostly on the brief idea about the autoimmunity. So I am giving you how to probe autoimmunity into case. Now, anyone have an idea that how to probe autoimmunity into case? Please share your view so that we all can learn in from our understanding and the cases. So I'm sharing you the idea about this. Anyone how to probe autoimmunity from the life of the patient and when where to probe. So this is what the quest taking part. So we have to improve. Yes, any situations where he blame himself. Absolutely, Dr. Yashashvi. When did the new symptoms or the change in the life happen? This is what we have to ask the first question. Absolutely, Dr. Nisha. Okay, what happened? What is the circumstances made you to change? In autoimmune compromise himself in any situations? Absolutely, Dr. Vijay. Somewhere he may compromise himself. Absolutely. But where? So we have to have a certain idea. If we gone toward the self is in any situation of the life, absolutely, Dr. Disha, where he felt he can complete his aim or authority, can't complete. Yes, absolutely. The false perceptions. Good. The false perception is a delusion. It can be anything of it. So self-destructive thoughts and convert into rubric. Sometimes you cannot get the delusion also, but sometimes there are the situation which will lead to the autoimmunity. There also you can think of that autoimmunity there is there. Where did the patient did not speak or not allowed to express his opinion or voice his opinion? Yes, absolutely is one of the process. Blame himself, the failure and the devaluations. Most of time this can be the conflict related to this. Okay, the patient has leukoderma, small spot on the leg, not spread so many years, but after the death of the mother and a quarrel in the family, in it spread very fast. Then what should be considered? This is the case. Ask the reactions. What is the after death of mother? What you felt and what was your reactions? So this is what the separation is there, and separation has been aggregated. Yes, Dr. Vinaya, self-devaluations. So how to probe autoimmunity? First and foremost things we have to understand the autoimmunity at the level. Know the pathophysiology of disease with patient history. Absolutely, Dr. Priyanka. That is very important clue in everything. Where the patient feels he is useless or now all is over or he is finished. Absolutely, the worthlessness. So these are the rubric you can think of. The guilt rubric goes into a autoimmune process. But first and foremost thing we have to understand what is autoimmunity. So from the basic point of view, I can share with you what is autoimmunity and then how to understand autoimmunity in detail. So the first and foremost point in autoimmunity, first and foremost, we have to understand the immunity. What is the immunity? So immunity is our defense mechanism to protect ourselves, and we have to maintain the we have to maintain the homeostasis, and we have to evolve to certain extent, and we have to live a longer life. It is for that the protection, the immunity is there. So this is what something which we called as the immune system or immunity is the basic understanding of immunity. Now what we have a disease of immunity. So if we have a disease of immunity, immunity gonna increase, which we called as the hypersensitivity or allergic component, which we called as the immunity got increased. We have immunity decrease, which we called as the immunodeficiency. So in immunity got increased, that means the hypersensitivity increased, so that we have a disease like asthma, we have allergic rhinitis, we have all the allergies are there in the hypersensitivity disorders that we called as the hypersensitivity or allergy. It is immunity got increased. So why immunity has been increased? So question is, what is the function of immunity? To protect the system and maintain the homeostasis. So if my immunity has been increased, so that means what? I am being unprotected, so I am feel insecure and the fear, and I need a more protection to defend against. So in that the hypersensitivity is there. So most of time when you have encounter with the asthma, when you encounter the allergic rhinitis, you must consider that where you have been frightened or where you have been feel insecure or where you have feel injured, that has to be found into the case, so that you will get the idea that this sensitivity is from this, and that has to be taken into consideration. So when you enter through that sensitivity, your case is clear. This is what hypersensitivity. Whenever you have a hyposensitivity, that means the immunodeficiency, that means like the cases of the compromised patients or cases of the AIDS and everything, acquired immunodeficiency syndromes. Okay, so in that case, what happened? The immunity getting so low or deficient to certain extent that there is no need to defend or no need to protect the body. I am going toward the destructions or death. This is something that he goes into state of resignation, he goes into state of looseness, or he goes into state of helplessness. So this is something you have to think in this hypoimmunity, or it is called as the immunodeficiency. Now, the third point is something which we called as the immunity which is misdirected. So first we learn the immunity which is hyperimmunity, which we called as allergies or hypersensitivity, which we another week we got immunodeficiency, which is lower immunity, and third is misdirected immunity. That means the directions of the immunity against the disease is against the body. So that is called the autoimmunity. Yes. That is autoimmunity. So now the concept of disease you have understood, that what is autoimmunity? Autoimmunity is something called as a misdirected immunity. That means immunity is there, but it is not directing toward the disease process or not destroying the invader, but destroying the self, which we call as autoantigen, destroying the self, and that is what the autoimmunity is. And what the autoimmunity represent in the three process. One is it start with the inflammation, then it goes into induration, and then it goes into destruction. So again in autoimmunity we have a three miasm, psora, psychosis, and syphilis. Okay, so in autoimmunity we have understood this process. Now this is something which is misdirected, that means guns toward the self. It is the destruction of the self. That is, I have to leave myself. This is sora. I have a fear and I have to live more. That is psychosis. And there is no love for the life, and I have become fearless. This is syphilis. But again, this is what I am going to destruct myself. It is something called as the autoimmunity. So here in autoimmunity, where to prove the autoimmunity? So going further into case taking, so we need to find out the autoimmunity at the level of the health, autoimmunity at the level of the wealth, autoimmunity at the level of family, autoimmunity at the level of intellect, autoimmunity at the level of relationship, and autoimmunity at the level of society. So every this aspect of everyone in the life, you have to find out the autoimmunity. So most of time the person is suffering from the big disease, but he is not taking care of his disease, and he is very careless and heedless. Again, it is something called as going toward the autoimmunity. It is a misdirections. Okay, so same way, it is not hard and fast rule that every person of autoimmunity directly you can find the delusion of that only, but you can find something beyond also, or something in the life situation you can find certain small things, but this is the autoimmune process. So again, autoimmune process, the intellect has been clouded, the intellect has been destroyed, and this intellect goes toward the destructions of the self. So the common autoimmune intellect rubric is the indiscretions, the lack of the circumspection to the situation. So I cannot understand the situation in the proper term, and that is what the indiscretion is. So indiscretion is a general intellectual symptoms of the autoimmunity. The second rubric, which what Dr. Vijayakar sir has told us and teach us in our actual process, that the patient is going in autoimmunity, patient is going gradually towards the death. That is a death desire. So death desire and the indiscretion, these are the two rubric, which is the general rubric for the autoimmune process. Whenever you didn't get anything out of it, you can take this rubric and the pathological process of the patient and the reactions after the autoimmune disease into the case, and prescribe also the remedy as a BCS. So also in the work also the autoimmune. So we have to find out what are the things are there in this autoimmunity. So what is in health? So if the person become indifferent to himself or indifferent about the health or not taking care about the self, it is the autoimmunity. Does not complain even though he had delirious conditions or he had very traumatic conditions, he does not complain. Again, this is the autoimmunity. Okay, so this is the syphilitic destructions of inter, does not complain unless questions, so questions के बाद भी वो complain नहीं करता है, that is colchicum. Lamenting about non-priority disease, most of time the person having a destructive disorders and he is taking he is giving you idea that the please give me a they have idea that I have give me the relief in this itching only. I don't take care of this destructive disease, but give me the relief in itching. So this is lamenting about the non-priority disease, which we called as the misplaced in the intellect. It is the indiscretions of the Baraita. So most of time the Baraita is there. So go to the sir's book Genetic Materia Medica, where sir has beautifully written the case of Baraita, in which sir has given the idea that he is lamenting about the non-priority disease. This is the Baraita. The anxiety about health, about the relative, and little concern about the self, as rightly said by Dr. Nisha, that he is not concerning about oneself and concerning about the others. That is something which we called as autoimmunity. So the anxiety about relatives, health about relatives, and little concern about the self, it is the remedy which is cocculus. So here the cocculus can might go into the autoimmune process. Indifferent to about his health. So again, the cocculus is there in indifferent to about his health. The arsenic is there in the autoimmune process. So arsenic in a sora is so much so anticipatory anxiety in psychosis. He becomes so much so fearful. He become very very clean, fastidious, and everything. In syphilis, he may go into a fear of death and everything. So again, when the arsenic goes into autoimmune process, he becomes so much so indifferent to about his health. Previously, he has lot of anxiety about health. He wants everyone to near him and give him consolations because he is so much so inconsolable person. So that is what the arsenic is. But when arsenic goes into indifferent, again there is one rubric in refuse medicines. So again, refuse to medicine is the arsenic. Again, there is a refuse to eat. Also, that is also the autoimmune process. So in this case, the arsenic is least concerned about his health. So here they goes into autoimmune process. So these are the few rubrics which will help you whenever you are taking the case history. So ask about, tell me about your health. So you are taking care of your health or not. So on the basis of that, you can find out these are the autoimmune trait. Anxiety about health gone when the symptoms was gone. So this is again the autoimmune symptoms. Yes, mirror image of the sora into syphilis is the autoimmune process. Again, autoimmune process, you have to differentiate something that is gone toward the self. Syphilis are of a two type. One is a destructing towards the other, and one is a destructing towards the self. So if it is destructing towards the other, then it is necrosis, and if it is destructing towards the self, then it is autoimmunity. So that has to be taken into consideration. So these are the few rubrics which will help you to understand the autoimmunity at the level of health. So you have to ask about certain about the health. Another point where you can think about what is the wealth. So the priority of the person is to earn money and maintain their life. But if the person is not making money and he become indifferent to making money, again this is called as autoimmunity. So this is something that they are spending money, they don't earn monies, and they are sitting at home and not working, goes into insane state. So these are the few remedies which goes into this state. So this is what indifferent to making money at the level of wealth. Aversion to business. Previously, he is a very businessman, but right now he has a complete aversion to business, goes into state of autoimmune process. So these are the few remedy and many more are there in this rubrics. Neglect his business. Okay, a big business is earning good, but he cannot understand that I need to take care of my business. He is neglecting his business and he is losing his name, fame, and money also. That is what the autoimmunity at the level of wealth. So, if the autoimmunity at the level of wealth is happening, what are the organ has to be affected? So, most of the liver is affected. So, it is called as autoimmune hepatitis. And in that case, the neglect his business goes into autoimmune hepatitis. The remedy can be a sulfur. So this is what are clinical tips which we have understood from the case and we have understood from the rubric also. Indifferent about the business. So we have the kalis are there, sepia and sulfur. These are the three remedies are there into the process of the wealth. So this is what you have to understand. Again, so you have to probe the autoimmunity at the level of family. So you need to ask about the relationship with the family. What was the relationship with the family? And when the relation has been spoiled, relation goes into destruction, relation goes into autoimmunity. That is what you have to find out. So what is that aversion to family? So most of time, this is something that many a time you came across the female patients who having infertility and all the reports were normal, but in the past history you can find out the torch is positive. So torch is something that is autoimmune virus is there into the body and which is not allowing to get pregnant or not allowing the persons to get the process of what we called as the conception. So in this case, yes, yes, Dr. Suvarna. In different to family, our family is strange. Yes, this can be anything. So in that case, the aversion to family is the most important. All the reports were normal except the torch is positive, and in that case, the lady having aversion to the in-laws, families, and everyone, and that lead to the infertility. Or sometime it may lead to the secondary infertility if the previous child is a female child, and after the female child is born, the all the attitude of the family has been changed toward that lady, and this lead to the autoimmune process. So here you can also think of this process aversion to the family. Cruelty, brutality, inhumanity to the family. So here the attitude goes into reactive patterns. So in these reactions, they goes into destructions of the family and they become cruel towards the family. So the Kali iod is one of the biggest autoimmune remedy in this case when they having a cruelty towards the family. So I had a case for hysterical lady having a cruelty towards the family that she used to have cruelty towards his sons, and she used to snatch the son of the face with the nail and everything, so that he can make. She is satisfied himself because of this process. So this is what cruelty, brutality, inhumanity, family to her, estranged from family. हाँ थोड़ी देर लगेगी मैं लेक्चर ले रहा हूँ हाँ ठीक है आ रहा हूँ यस estranged from family to her. So again, you need to find out the estranged from the family. So she become estranged to the family. So these are the few autoimmune rubrics. So estranged from the estranged stranger being kind with, but not with his family and entourage. So this is what the family के साथ कुछ भी relation नहीं है, पर बाहर वाले लोगों के साथ बहुत अच्छा relations है. This is again autoimmunity. So there are the remedy which is called as Casting of people is a necrotic rubric. It is not the autoimmune rubric. So platina is not there in autoimmunity, but platina is there in necrotic type of personality. So casting of people, I am cutting off. So this is necrosis. Hatred for the family. Again, the hatred for family can be both. It can be autoimmune also, and it can be necrotic also. So we have the arsenic, natrum, and sepia. Yeah, indifference is something which we called as autoimmunity. Indifferent apathy towards one's family, phosphorescent sepia. So most of time the sepia is one of the remedy you can think of in autoimmune process. Kill desire to knife when looking at to husband or the member of the family. Again, this is what something that it is one kind of called as necrotic as well as the autoimmune process. So Naxomika can be goes into both process. Okay. Violence, vehemence, family towards the autumn or veratrum alp. So this is something that cruelty and violence both are the remedy, which is something which we can't think of in the autoimmune. So autoimmunity towards the family. Yes, can we take 4-second Owen child? Yes, sickle cord is one of the remedy. 4-second the relationship, 4-second the child is the remedy. Sickle cord can go into autoimmune process. Yes, yes, exactly. Sickle cord is one of the remedy you can think of. So these are the few, when you are evolving in such a way, then your history taking it becomes so much so proper and you can understand that it is very important. Malicious toward loved one is a necrotic in nature, it is not autoimmune. Again, the autoimmunity at the level of intellect, I previously mentioned that the lack of circumspection, no discretions between the self and non-self, it is called indiscretion. So most of time the indiscretion is the general rubric for the autoimmunity at the level of intellect. So when intellect is clouded, it may lead to the self-destructive process, which we call as delusion of self-worth. So most of the delusion which is related to the self-destruction goes into this process because intellect has been clouded. So here you all have said rightly said that their process of worthlessness, their process of gun towards the self, there is a self-destruction, devaluations, all are going into this perception, and that is what delusions of self-worth. Self deprivations. There is one rubric, self depreciation. The NASA is one of the remedy, and NASA is one of the best autoimmune remedy in cases of when you have autoimmune process at the level of heart, autoimmune process at the level of cardiac, autoimmune process at the level of blood vessels. So you can think of, yes, self torture is one of the autoimmune rubric. So now I must request all the learner that you have to understand the materia medica, you have to understand the remedies, try miasmatically, and then the fourth column you have to put that what is the autoimmune rubric to that particular remedy. So you have to take the repertory, reverse repertory from either a canned, from the complete and everyone, and from that you have to put certain rubric in the autoimmune box that these are the autoimmune part of this remedy. These are the autoimmune part of this remedy. It can be perception, it can be related to the health, it can be related to the wealth, it can be related to the family, it can be related to the intellect. So you have to do one exercise and learn this. Again, the cloudiness of the intellect has gone, so it is called as the confusions. So confusion also is the autoimmunity at the level of intellect. Relationship, again, the in relationship, so you have to understand the relationship is aversion to herself. So कई लोग ऐसे होते हैं कि मुझे खुद से ही घिन आती है, मुझे खुद मैं अपने आप को पसंद नहीं करता हूँ, मैं अपने आप को लव नहीं करता हूँ. So this is something called as aversion to herself, aversion to family members, aversion to men and women too. So these are the few aversions which goes into the process called as autoimmune relationship. So a lady had scanty menses since 1 year after MTP and ENC were done, and now after taking hormonal treatment for the scanty medicines, her AMH level is very low. What is to consider in such case? We will take a infertility approach later on. So I will share this. Scanty menses means first and foremost, in the first symptoms is scanty menses. Scanty menses means what? Endometrium lining has to be not made properly. That means what? What is the endometrium? Endometrium function of the endometrium is to nurture the child. Okay. AMH low means what? The ovary is not going to give you a best ovum. That is AMH is low. So what was the mind of that lady? That lady wanting that child, but her body is telling that it doesn't want that child. So that is what, I don't want to nurture the child, and I don't want a baby. I don't want a child. So ask the question, why you don't want the child? What is the behind? What is the thought process, subconscious thought process behind that? And that is the case, and that is the remedy you will get. Okay. In the Kara, you can go to the reverse repertory. I don't have any reverse repertory book, so I can learn from this. If we have three, four rubrics, syphilitic, autoimmune, how do we decide which one is one of the? In for that hierarchy of autoimmune rubric has to be learn. So, Dr. Rashmi, I will share this hierarchy of autoimmunity in later sessions, because I had compiled all the autoimmune process and understanding autoimmunity in depth. So I had made this hierarchy of the sessions, and again in a SCPH class, Dr. Asif sir has taught the hierarchy of the autoimmune rubric. So you can join SCPH class to learn this also. Yes, Dr. Nisha, it is the endometrium is for the nutrition. Yeah. So aversion to men and women too, aversion to parents, aversion to certain persons, aversion to children of his own. So again, in that case, Dr. Priyanka, you can think of this rubric also when the lady don't want the child. See why she had gone into MTP, why she had done DNC. So ask the questions. A common layman answer that it is too early to have a child in our life, so that we have to enjoy our life, and we have to, that's why we have done MTP. This is the layman answer. But for that, what you need to understand, to enjoy the life. So I don't want to take any responsibility of the child. So aversion to children, aversion to responsibility, and the person might be very, very libertine. So from that you can enter to the case. Homosexuality is not in autoimmunity. Homosexuality goes into a which we call as a perversions. Yes, that's it. That's it. There is a responsibility of second child. Again, the responsibility, aversion to respond. So she might be a libertine remedy. So you can think of this way. So aversion to children is own. नहीं, मेरे में कुछ कमी है. That means a different things. क्या कमी है? Find out करो. Directly don't take at aversion to yourself. Okay. इनकंटिनेंस ऑफ यूरिन, दैट मीन्स कंट्रोल कहीं लूज हो रहा है. सो टेरिटरी में कहाँ कंट्रोल उसका गया, वो फाइंड आउट करो. सी ऑर्गन क्या अफेक्टेड हो रहा है, और उसके अंदर कौन सा मायाज्मेटिक प्रोसेस हो रहा है, वो आप फाइंड आउट करेंगे. तो आपको पता चलेगा कि आपको कौन सा क्वेश्चन पूछना है, और कौन से क्वेश्चन के हिसाब से कौन सा रिएक्शन पेशेंट का आ रहा है. दैट हैज टू बी टेकन इनटू कंसिडरेशन. So here, if you have the patient, that is patient having incontinence of the urine, and the patient is saying that मेरे में ही कुछ कमी है, that means patient goes into a low self esteem. लो सेल्फ एस्टीम से उसका कंट्रोल कहाँ चला गया है, टेरिटरी में उसको क्यों ऐसा लग रहा है कि लो सेल्फ एस्टीम. इनकंटिनेंस मतलब क्या? मुझे टेरिटरी मार्क करनी है, पर मेरे पास ताकत नहीं है कि मैं मार्क कर सकूं. ठीक है. तो क्यों हो रहा है, इसमें अवर्जन टू सेल्फ कहाँ से हो गया? ठीक है. तो इट कैन बी वन ऑफ द हेल्पलेसनेस. एब्सोल्युटली डॉक्टर निशा, दिस इज द हेल्पलेसनेस फीलिंग. Great. So you have to think in this way. Okay. Losing the control over the continence. Great. So these are the autoimmunity at the relations indifferent to loved one, animated the stranger. We have a fluoric acid, but fluoric acid having the autoimmunity at the relationship, fluoric acid goes into this state. Indifferent to agreeable things, the case of arnica, most of time sir has given this is this those things which is very agreeable to the person and now it is not agreeable. So I had one of the case of female child, not child, the female of almost 16, 17 years, 18 years, and she had an allergy to chana dal or something which is made from the chana, which we call as what we call as in English. I don't know. So that chana dal, allergic to item of any of the chana dal. What we I don't know English name of that. As a black gram, yeah, chickpeas. Okay, fine. So what is that? I asked whole the history and then I asked mother what was the things. So mother says I used to have a fond of this black gram or chickpeas. I love that and my child is not loving that. So on the basis of that, I perceive something that indifference to every agreeable things and prescribe arnica to that child, and the child was better in allergic rhinitis, and now she is not what we call as allergic to the chickpeas or grams. Okay, black gram. So this is something I took that autoimmunity in even though in hypersensitivity also sensitive to agreeable things. Again, this is also arnica. So these are the autoimmunity at the level of relations. Autoimmunity at the society, that means aversion to society, aversion to particular persons or misanthropy. So we have a natrum carb is one of the remedy. Indifferent to welfare of the others, sulfur, nux omega, and phosphoric acid. Company desire with aversion to society. Again, the conaium. Contemptuous of society and mankind of. This is the platinum. Here, the platina is only towards the society, not for the self. So this is something which you can platina can go into necrotic process more rather than autoimmunity. And aversion to work, so indifferent apathy to domestic work, the female having the domestic duty. So again, when you find the female don't want domestic duty, it is autoimmunity. Antisocial is not a autoimmunity. Antisocial is something called as a destruction, so pure destructions, and anarchism is also pure destructions. It is not autoimmunity. You need to find out why the person become antisocial. That is the cause. That is the sensitivity. There are the remedy which is causticum goes into autoimmunity, antisocial. Mercury goes into antisocial. So why this remedy goes into antisocial? That has to be find out from the patient's perspective. Duty aversion to domestics. These are the remedies are always prescribed on the basis of aversion to domestic duty, sepia, sulfur iodine, chancres. This is the autoimmune entry point at the level of work. Discourage with aversion to work, pulsatilla, aversion to her usual household work, sepia. So we have, so this is what the question to Dr. Manhar is that uh, how to find out the autoimmunity. So in case of anti-TPO, you can find out this also. So whenever you find this also and enter through this and you get the remedy, then you will reverse this process of reductions into anti-TPO. So hope you got the idea about this. You have to find out autoimmunity at these places. Yes, Vinaya, the question is coming to third layer or seventh layer. I will give you the answer. Questions. Dr. Priyanka Mehta has asked the questions that the posology, selections, repetitions, when not to infer with the first prescriptions, which cases to prescribe the higher potency like 50 m. So already in the first sessions, I have discussed everything about the posology. Again, in autoimmunity, the posology is something that you have to prescribe the higher potency 10 m, 50 m, or cm, and in that repetitions is the needed. In the most syphilitic disease, when life is in a danger, like a ICU cases, when the person is on ventilator, prescribe the higher potency 10 m, 50 m, or cm, and the repetition is needed. Even in coma and ICU cases, the local applications is the most important. So, in most important repetition, local application, because ectoderm directly in connection to the neuroectoderm, so it directly stimulates that. So hope Dr. Priyanka, you get for your understanding of posology, you can go to the YouTube channel, go through the question answer sessions video, and all the posology and understanding of posology has been given in that video. So go to that video and understand. Uh, Dr. Mital Gorasia from Surat. Sir, in many cases of PCOD patient, when medicine was given, the patient got her menses within 1 week, then heavy flow continue for 10 to 15 days. In this type of cases, what should we do? We can wait or repeat the same medicines or change the potency. How many of you have a same experience and the cases like this? And what to do? Let's have a little interactions. Do you have such cases like that in the PCOD whenever you prescribe the remedy? And after the remedy, the patient having the heavy flow 10 to 15 days and the pay flow is not stopping. Then what to do? Yeah, absolutely. Everyone have the same experience. These are the common question comes to us in our day-to-day practice. So what should we have to consider in this case and what we have to maintain that? Yes, absolutely, Dr. Vinaya. I feel this is a partial simillimum. Some remedy related maybe help. The remedy need to be changed. Yes, absolutely. The understanding is like that. Okay, but on what basis we have to understood these things? So by disclosing, firstly, we need to understand the normal physiology behind the menstrual cycle. Yes, we can think of suicidal thoughts, but not in every case, doctor. It is a mind of pathology in certain cases when the person having a heavy flow and patient goes into a low HB less than 4 milligram and patient having so much so pallor and so weakness, that is which in that cases you can think of suicidal thoughts and suicidal disposition with the heavy flow. There are many females who having a heavy flow but their hemoglobin remain constant 10 or 9, 9.5 or 10 in spite of having 20 days or 30 days of the heavy flow. So in that case, you cannot take suicidal thoughts because it is something which is something our interpretations, not the actual patient's versions. Okay, so first and foremost things we have to understand. Yes, yes, the same way. The questions answer, Dr. Nisha, your questions answer is also there in this process. And one more frequent problem is 1 month cycle comes and then next month no man says what to do. Absolutely. Okay. So first and foremost thing we need to understand the physiology behind the menstrual cycle. So all the female knows about that, but they knows partially. That I feel because the questions from the female doctor. So what happens whenever you are the female? So you can consider that is absolutely normal for me. Everything seeing normal for everyone also. So many a time many female having a 32-day cycles. For that every female has 32-day cycles is normal, but if the cycle is less than that days, so it is something beyond or beyond that you have to consider. So first and foremost thing we need to understand the normal physiology from the books. So the physiological cycle which we called as the lunar cycles, and it is mostly consists of the 28 days. So it is in the ancient time also it is associated with the lunar cycles, the lunar having a 28-day cycles. So same way our physiology has the 28-day cycles. And most of time what happens that the first day of the lunar cycle starting with the periods, then at the full moon the ovulation has been started, and at the new moon again the female goes into menstruation. So this is something which we called as a lunar cycle. The same way our physiological menstrual cycle is like a 28 days. So what is the 28 days? The 28 days consist of the days of estrogenic stimulations as the follicle stimulating hormones and the estrogen. It is called as the follicular phase controlled by FSH and estrogen. And the days of progesteronic phase, it is fixed up to the 14 days, that is mostly occur after the LH surge, luteinizing hormone surge, giving rise to ovulations and development of the corpus luteum, followed by progesterone declinations and leading to the menstrual flow. So the days of progesteronic phase is very fixed because the corpus luteum has a reserve progesterone for the certain time period only, and after that corpus luteum become corpus albicum and destruct to the cell as a scar in the ovary. So this is corpus luteum giving rise to a progesterone, and then progesterone has been depletion again and again and again. That depletion goes into a certain extent. So after the cutoff of depletions, again the patient, the lady got menses. So this is of 14 day cycle is fixed. The progesteronic cycle is fixed. Estrogenic cycle can be variable. So whenever the PCOD is there, the estrogenic cycle has been lengthening and progesteronic cycle has been the same. So when the ovulation is does not occur, that means what, the estrogen is not going toward excess into certain extent, so which we called as oligo-ovulations, or which we called as immaturations of the follicles. The ovulation does not occur. If the ovulation does not occur, the lady might not get the menses. Okay, but anovulatory cycles where the lady may get menses, where that is what we called as something that whenever the lady was given OC pills. So in OC pills, the dose of OC pills is counting from one tablet to the last tablet, and the lady is taking that tablet in a sequence. And at the end of 28, 21 days, after 21 days, she had a 7 days of the no medicine period. After that, she goes the menses. So this is called anovulatory cycle. But here we need to understand the progesteronic phase is the 14 days only, and we need to stimulate the LH surge, which giving rise to the ovulation. So if in cases of PCOD, your medicine has been stimulated the LH surge and ovulation has happened, then and then your menses has been comes, and sometimes the menses comes and it is not because of your medicine, it is because of natural physiological process of the female. So once the female having the period comes and next cycle again no period, so the answer is your medicine is not touching to the core of the patient. Dr. Nisha, hope you got this. So PCOD is psychosis. It is cover mostly occur due to the oligo or anovulations, or sometime it is the hyperandrogenism, that means called as a PCOS, clinically hair growth and acne. Or the third is the polycystic ovary, the USG shows the immature follicle. So this is what the 3 point giving rise to a PCODs. In this case, if more bleeding after your medicine, which means the patient is in the metrorrhagia, so patient is in a pure psychosis. Now going toward the destruction, that is metrorrhagia. So it is metrorrhagia is psychosyphilitic. So the compass of our learning is we have to probe the miasm. So here the miasm has been shifted from sora to psychosis to psychosyphilitic. So the remedy has not been reaching to the phase. So here the progression of disease from psychosis to syphilis. So your medicine might be partial. Reconsider the case and prescribe the right GCS as rightly said by Dr. Nisha. So here this is the very important. Again, what we need to understand, right time to wait after your GCS is 15 to 20 days. This is very important. So once your medicine has been prescribed, you stimulate the LS, you stimulate the ovulations, and after 14 days you get the menses. Patient get the menses. That means the right time to wait for the GCS is 15 to 20 days. So in that days, menses should come. And also you need to understand it should be regular with the consequent cycle. So once you have stimulated, you have it has to be regular with consequent cycle. Then and then it is the right follow-up in the PCODs. If the menses has been come once, the next cycle period is not coming, that means your medicine is partial. Okay. So you have to understand that the right medicine, or sometime you might have to repeat the remedy after the cycle has been come. This is what my clinical experience. I have prescribed many a time at the fifth day or a sixth day of the cycle. I just need to repeat the dose, and then the patient might have the same cycle in the next cycle. So this had to be, if you find that your medicine is exactly the right remedy, right GCS, and sometimes you need to stimulate, because in PCOD it is a psychosis. So in psychosis you need to repeat the case, as I have shown you in the last session, that posology in psychosis you need to repeat the doses, and the potency should be 200 only. PCOS is already a psychosyphilitic. Yes. Yes. Dr. Monica has asked one question. What is the approach of treating psoriasis? Should it be treated like a layer third disease and GCS be given, or should it be given as autoimmune? Again, the same question was asked today by one of the doctors. Yeah, Dr. Vinaya has asked the same question. So, uh, yes, in case of metabolic syndrome where the patient has additional symptoms like a PCOD, which PCOD like too much obesity, insulin irregular, etc., what will be the approach? Same GCS, Dr. Nisha. In that case, GCS. So first and foremost, things we need to understand the disease. So psoriasis is the third layer disease only, even though in many book it is written that it is called as a autoimmune disease, but actually it is not the autoimmune. It is the disease of the third layer only. So we have to consider the third layer in psoriasis and prescribe the GCS in this case. So GCS is the only answer to the psoriasis. No PCS has been treated with the psoriasis. So psoriasis cannot be yielded to the PCS or autoimmune remedy. So it is only third layer disease. And but in that case, what I have taught you how to probe the autoimmune. So you can enter through the autoimmune process of the patient, like in a work, in a family, in a situation. So aversion to family, you can enter in the psoriatic cases also, because this can lead to the process. So you can enter through the autoimmune process, but it is the GCS of that persons only, not the PCS. So hope you got the answers. Okay. Another questions from Dr. Pankti Surti. The patient, age 60 years, female, having complaint of seeing worms on herself and surroundings since 8 years. She is constantly picking worms from hair and throwing it when she is sitting freely. Which is the miasm and which remedy should I give? So first and foremost, my answer to this, I am not giving you any medicine for the case. I am just here to give you the idea, that thought process that sir always said. Sir always says that if I give you fish, you will eat for one day, but if I teach you fishing, you will eat for lifetime. So what is the process is, so here in this case, the symptom as you mentioned is out of control behavioral pattern, going into delirious condition due to some alter perception. So here we can think of the rubric like this: the delusion, animal, vermin crawl about, siege. So this is what the everything was written in the same way. So there are the 14 remedies. Out of this, you can think of one of the remedy according to the dispositions of the patient. Another questions: the miasm of the asthma. Yes, delusion, delirious, yes, hallucination, delusion. So it is a delusion rubric, but it is something that absolutely mentioned that she feels that is a vermin. So everything is there in this process. A miasm of asthma, and a patient 50 years male having asthma since 18 years complain of breathlessness at night 12 midnight, imputed by lying on abdomen, relieved by sitting with the face forward bending, tried many homeopathic medicine but didn't really him. Sir, please suggest me the medicine for this. So again, my question is, I am not giving you a fish to your case, but I am giving you the process of fishing. So I'm not giving you the remedy for this case. Okay, but I'm teaching you something that how to approach this type of cases. So whenever there is a bronchial asthma presented, in follow-up irregular menses after psoriasis is disappear, what is the approach? Suppression. Third layer to the fifth layer. Change the medicine. It might be the partial remedy. Dr. Vinaya, you can get the answers. So in bronchial asthma presented in the two form, one is the acute asthmatic attack or the second is called as a chronic asthma. So let us understand asthma miasmatically. What are the causes of asthma? The acute asthmatic attack. Let us understand the asthma miasmatically. What are the causes of asthma? So in understanding the asthma, so first, the first cause is the spasmodic contraction of the respiratory tract. It is called as a SORA, the spasm of the bronchial tube. So SORA, sudden spasm, and then the spasm become normal. So this is SORA. Second, there is a chronic thickening of the respiratory tract, so bronchial tube become thickened, so it is called as a psychosis. So narrowing of the bronchus, it is a psychosis. And the third one is the destruction of the alveoli and the bronchi, it is a syphilitic. So we have three process as the miasmatically. One is the spasmodic contraction of the respiratory tract, second is the thickening of the respiratory tract, and third one is the destruction of alveoli and bronchi is a syphilitic. So according to that, we have to understand I'm asthma in all three miasm, and predominantly it is a soro or soro-psychotic. Whenever if you have a destruction of alveoli and bronchi, the diagnosis can be bronchiectasis or sometimes you may have ILD. So asthma due to interstitial lung disease, it is syphilitic in kind. But the episodic asthma patient comes with us, it is mostly a sora or soro-psychotic. So this is what the process is. So in that case, you need to find out the 18 years he might be having a soro-psychotic asthma. So again, what is that? What is the tips by Dr. Vijay sir? The aggravating factor can be SORA or the syphilis. Ameliorating factor can be psychosis. So in asthma, aggravating factor means it is a sensitivity. So it is important to remember that one should never take modality in asthma cases, just use it as a confirmation. So don't take as an entry point as a modality in your case, but in according to dispositions of the patient and what is the reaction of the patient in asthmatic spell, and then the modality has to be entered. If that remedy is covering that, that has to be taken into consideration. Otherwise, do not enter through the modality. So here we have a modality like the midnight aggravation and relieved by bending forward. So a remedy might come in your mind is something which we called as the arsenic alb. But you have prescribed arsenic, but patient is not relieved by them. So it is something that modality does not give you the remedy. Okay. So modality is helping you as a sensitivity in the case. Now we need to know the sensitivity of the constitutions, and the sensitivity is available clearly in the SORA and syphilis. So, and reaction belong to the miasm. So we need to understand the sensitivity and reaction. So what the person is doing during the state of asthma. Is he weeping? Is he crying? Is he restless? Is he taking care of himself? Is he wake up other? Is he want someone in room? Is he wants mother? So this is what you have to understand the reaction during the state of asthma. And whenever you get that things, then and then you have a certain remedy into it. So Dr. Vijayakar has made a beautiful chart about this asthma. And whenever you have a patient of asthma, you can use this chart. This chart is divided into two phases. If the person having asthma at night and person wakes the other and do not wake the other, so this is what divided into two process: wake up others and do not wake up others. And why the person is waking others and why person is not waking others, the reason behind is that has to be taken from this chart, and that chart has to be used. So one of my friend, Dr. Ilango from the south, who has made this chart beautifully and he has updated this chart in 2020. So in this, the customer chart is divided into two: don't wake up others and wake up others. So in wake up others, we have these categories. So why the person is waking others? Person is waking others because person wants supports. Person is weeping. Person is not weeping. Person is arguing. Person is angry and quarrelsome with the disease, or person get into a panic state. So when the person gets into panic state, so we have certain remedies. Person goes into aorta. I don't want to answer the question. So we have certain remedy. Person become angry and quarrelsome with the other person. So we have a certain remedies. So from that you can utilize the chart and the reactions of the persons. So you can snapshot this chart. I will share this chart in all of the group and even in the Telegram group so that you can learn from this. And the person do not wake up. So those person do not wake up other, that means the person is self-sufficient. The self-sufficient person might be because of the person having anxiety concerns. Person don't want to share his feelings, so he might be introverted. Person is very very conscientious and diligent kind of person, so he cannot wake up others. Person is very very tolerant and positive and a strong personality, so he cannot wake up others. Person become caring for others, उसको जगाएगी, उसकी नींद खराब होगी तो goes into autoimmune process, so that's why they are not waking others. Either person is indifferent to the suffering, ये तो रोज का ही है, मुझे क्या करना है, हो जाएगा, सो जाते हैं, कुछ नहीं, कुछ किसी को जगाना नहीं है. So that is what indifferent to persons. Or sometimes the person is what the, मैं क्यों सबको जगाऊं, मैं अपने आप से कर सकता हूँ सब. So that is what because of the haughty personality. Or sometimes the person might goes into a despair state, that also goes into a state of this. So out of this chart you can understand the remedy, so that you can understand. Some kid may have a reaction like, will I have to take this medicine lifetime? uh, will I not be able to eat some things? Will I not be able to run like other? This is something called anxiety, more of an anxious kind of reaction. This is a panic reaction, goes into this futuristic fear. So he might be having some restrictions. So this is something you have to take into. Yeah, sadness is there also. Sadness is also there. He can feel despair. So this is what sadness. So sometimes insecure persons and sadness, you can think of the remedy is calcarea carb or arsenic. Okay. So this chart is very, very beautifully mentioned by Dr. Vijayakar sir, and Dr. Ilango sir has updated this chart. So this is helping you in each and every cases of asthma when you get the case. So this is very important, and you have to snapshot this so that you will get the idea. So I'm not going into detail of this, but I am just giving you a clue so that you can get the right remedy from this chart. So there are many remedy which is repeated. So there are few of the remedy which is there most commonly prescribed in asthma cases like the arsenic, calcarea, natrum sulf, sepia, silicia, ferrum, sulfur. These are the few remedy which is most frequently prescribed in cases of asthma. Another questions by Dr. Pratibha Naron from Mumbai. Sir, to what extent does the homeopathic medicine have a scope in the curing the patient, and does the psych mind play an important role in it? So we all know absolutely that it is not the scope of homeopathic medicine in case of patients suffering from any disease. It is the scope of homeopath. So Master Hahnemann says that the limitation is of not of homeopathy, but limitations of the homeopath himself. So if my teaching will be followed properly, there is infinite benefits with the homeopathy. So it is the limitations of homeopathy who fail to cure, not the homeopathy. And there is always the connection between the mind and body, and it is not two different things. So one has the unit, so it is most important to consider the psyche and the role. In case of PCOS, if every month sign of in case of PCOS, if every month sign of approaching menses, but only white discharge appear, is it important? Can I take this in the repertorial totality? There are the rubrics in that the sensation as if menses would appear, or you can take the leukorrhea instead of menses. These are the particular syphilitic rubric has to be there into the case. So if it is clear cut in every time, then and then you can think of this as the remedy, provided you can understand that the patient having the sometimes the patient having a retrograde menses, sometimes the patient having hematocolpos or there. So you can think of that whenever you can find it in the case. Another question is miasm in brain tumor, brain stem with the hydrocephalus. Psychosis. Male child with the brain tumor with hydrocephalus since 5 years. He is sensitive to noise or enter her room or open his room door. That means what? I don't understand. The miasm of the brain tumor or hydrocephalus is psychosis. So hydrocephalus is the protecting the brain. So why the head is needed protections and why there is a brain tumor? So you need to find out the cause behind that in the mother's womb or mother history during pregnancy, so that you can find out that patient has amenorrhea since 9 months. Your medicine is not reaching to the genetically to the patients if the genetic provided the age, or you can go through the AMH level, or you can go through the all the investigation the why the person having AMH, or sometime you can do the what we called as prolactin level. So many a time the prolactin is so high due to the pituitary microadenoma, and then also she might having the amenorrhea. So cause is not at the local level, but cause can be at the higher levels. Find out that cause and prescribe. Yes, fright or delusion will receive injury on the brain tumor. There is one remedy that is delusion receiving injury on the head. Rubric is there, and the nausea is one of the remedy. So you can think of, but it is not like that. So you need to take the whole case, disposition of the child, reaction of the child, disposition of the mother, mother state during pregnancy, and during pregnancy, mother's reactions after fifth or sixth month. Okay, or hydrocephalus because of aqueduct stenosis. So you can think of the ophidia remedy when there is aqueduct stenosis is there. So you need to think of this. So you need to take a whole case and then prescribe. Okay, sensitivity is not important. Sensitivity is SORA. But here you are treating the psychosis, so we need to go higher on that. But after entering into the whole case, you need to probe that sensitivity is there in the patient or not, there in the remedy or not. So this is what you have to match the sensitivity at the end. Is there so another questions we have. So we will have two questions more more, and then we will finish this sessions. So the question from Dr. Kaustubh Thackeray. Yes, HB has to improve because it is going toward the syphilis. In case of PCOD, when the anemia is there associated with HB is low, so HB has to improve, then PCOD has to be improved because HB is life. So SORA has to be first to be improved, and then she will get the menses. Absolutely, Dr. Priyanka. So this was the approach. So approach for the female infertility. I will share whole the approach of female infertility in later stage, later sessions next time, or maybe in the future, because I'm preparing that, and there are a lot of cases which I have treated as infertility. So I will get most of the things very easily in infertility. But today I'm sharing with you one of the case with all of you. And the question asked by Dr. Kaustuv Thackeray from Amravati, that approach for the female infertility case is having a fallopian tube block and the male having a azoospermia when all reports are normal. Okay. So first is approach to infertility is a multifactorial in nature and it is directed toward the causes. So commonest causes of the female infertility is due to one of the reason is the commonest reason is PCOD. Second is endometriosis. Third one is the uterine abnormality. It may be fibroid or the polyp or the tubal block or the inflammations or vaginal stenosis or the spasm. So these are the few causes of the female infertility. So we need to treat the cause and according to cause. So already I have mentioned the approach to PCOD in the previous session, or already the lecture on the PCOD has been uploaded on the YouTube channel. So you can find out the approach to PCOD and you can get a lot of cases has been treated according to that. So right now I am sharing with the case of a right tubal blockage. So the case of the tubal block, the primary detail, the patient came on the June 2023. 31 years female housewife diagnosed with the secondary infertility due to right tubal blockage. Last investigation dated on 6/10/2022, which HSG report shows the right tubal block. So patient came with the complaint of not getting second pregnancy, difficulty in conceiving. She had took many hormonal treatment and also underwent IVF treatment, but didn't get successful. So the report shows that it is a right side tubal block. Okay, this was the case. So how to approach this case? So case is, see how to approach this case. First and foremost, the tube is blocked. So what to do in this case? Is there any idea? She don't want to get pregnant. Absolutely, she don't want to get pregnant. That's why the having a tubal blockage. But patient want that I want child. I want child. Okay. Just find the cause. Aversion to responsibility. Yes. Anything else? Some issue from the husband or the in-laws. Yes. Absolutely. Then, as you know, the secondary infertility. She had one child, baby, and she trying for the second one. Yes. There must be a problem with the job. Anything else? Again, we have to understand the miasm tubal block is because of there is a scarring or the inflammation goes into a thickening and that the block is happening at the tube. So I don't want allow to enter to into this and I don't want fertilization, so that the tubal block has been created, and that is what ultimately it goes into a infertility. So why she had this tubal block is this? Ask yourself. Psychosis, absolutely. The miasm is psychosis. So ask what you have to ask in psychosis. Find out the insecurity and fear. Simple. So we'll go to the case. So you will get the idea. Yes. So what should be the insecurity regarding this? Yes, there may be the history of abuse. Absolutely. Very good. Dr. Ajay, absolutely right. The possibility, money and husband, one can be insecurity. If it is money, then the liver is the culprit. Here, not the fallopian tube. So you need to understand the organ and its functions. Yeah, more responsibility. Yes, due to female child. Absolutely, one of the reason. Very good. What could be the possibility, Dr. Vinaya? Due to female child, what was the insecurity? Financial insecurity, one of the reason. Yes. So I will open the Word file. If it is not visible, let me know. So is it visible to all? Word file? No. Okay. I will stop sharing and again I will reshare the. Now it is visible. I hope. Yes. 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 Okay. Fine. So this was the case of a 31-year female housewife, secondary infertility, right? This was a raw case. I have not prepared the presentations, but this is what I am going to show you something which is helping me in the case. So problem in conceiving, she had taken many hormonal treatment, also taken IVF, but not successful. Life space G1, P1, A0, L1, the first female child. So, sir, I have one daughter. Now I don't want daughter. I asked one questions. Why you came for the treatment? So she says, I have one daughter and I don't want another daughter because I want a male child. So I directly asked why. This was the entry of the case. So I directly asked the questions why. So patient says it was in a Gujarati. So I will convert into Hindi or English. So many Gujarati doctors are there. So અત્યારે સમાજમાં કેવું ચાલે છે બે છોકરીને સાચવવું કેટલું અઘરું છે છોકરીને મોટી કરવી બહુ જ અઘરી છે આજના સમયમાં કેમ કે આ સમાજમાં કેવા કેવા બનાવ બને છે રેપ થાય છે બલાત્કાર થાય છે નાની નાની છોકરીઓને ઉઠાવી જાય છે ઘરમાંથી મારા ગ્રુપમાં બધાને બે ચિલ્ડ્રન છે બટ મારે જ નથી so this is what the feeling that the she feels that in a society there is a lot of things happening because of the female child and it is very difficult to upbring the female child so I ask why because in this time in this era because in society there are a lot of event is happening like there is a rape in the society so even they kidnap the small kids and everyone so this is what something she had that fear and she said that in my group of the group friends there are everyone has a two children but I have only one child again the sensitivity so she had a નાની નાની વાતમાં બોલવાનું થઈ જાય મારા ધીરાણી સાથે એ મને કંઈક બોલે તો પછી મને મનમાં ટેન્શન આવી જાય so she is very very sensitive to small matter and if her dheerani is criticizing her she feels tense about that she is very sensitive to criticism reaction sir મને એમ બોલવાનું આ બધી વાતોમાં ઓછું ગમે so she don't want to talk so she talk in this post to કઈ ના ગમે તો પણ મનમાં જ રાખવું so she do not share his feelings she had a fear anger but cannot tell to anyone she cannot told so cannot express this anger this is not something that the anger suppress બધો જ ગુસ્સો મારી છોકરી પર ઉતરી જાય so she has to express his anger not towards the elder but she has to express anger toward her daughter child and she is very very sensitive to the quarrel in the family ઝઘડા ફેમિલીમાં ઝઘડા થાય એ બિલકુલ ના ગમે and then he said that બેબી માટે એટલું બધું ટ્રાય કરીએ છીએ બટ નહીં જ રહેતું ફર્સ્ટ પ્રેગ્નન્સી તરત જ રહી ગઈ હતી બટ આ સેકન્ડ પ્રેગ્નન્સી રહેતી નથી બધાને રહી જાય છે મારે જ નથી રહેતી so she said that we will try our best to get the pregnant. First pregnancy you got very easily. She got pregnant very easily in the first, but in second pregnancy it is very difficult. Everyone got pregnant in our groups, but I cannot. And she said that whenever the date of the menses has been come, she felt so much so tense, and she said that if menses would come, then what happened? So this is what the feelings and she is living in the nuclear family with the seven-person in the family husband mother-in-law father-in-law brother-in-law sister-in-law and daughter all are in the family are very very aggressive and angry uh, in nature and she is very very fearful and timid બીક લાગે નાની નાની વાતમાં કંઈક ખોટું કંઈક બોલશે તો that is sensitive to criticism menstrual history she had a cycle normal cycle dark in color thick scanty sticky discharge no clots dullness during the menses no desire to work irritable leukorrhea is there then I ask about the sexual history creamy leukorrhea She had last month she had a right-sided Bartholin cyst. મને સંબંધ રાખવાનું મન જ નથી થતું. ક્યારેક એમ થાય કે રાખીએ બટ ઘણા સમયથી સંબંધ રાખવાનું મન જ નથી થતું. Sexual desire diminished but increase in afternoon. Uh, Dryness of the vagina with the pain and burning. No desire for foreplay. કોન્સ્ટન્ટ ફિયર કે નીચેના ભાગમાં પણ પેઇન થશે એમ થોડું સંકોચન જેવું લાગે. So this is what the sexual history is most important in cases of infertility. So she said that I don't like to have a caution and even no desire for that. This her desire was been diminished since many long time. She had a dryness of vagina and whenever she had a caution there is a pain and burning, and she has a constant fear that the vagina has been having a spasm in the vagina when the husband is inserting the during the caution. So this is what the things. History of 3 months back during the intercourse process, the daughter got waken up, and since that time she feels that always having a fear that if the daughter waken up, what will happen. So fear when she was being exam again. This is what the things she said that whenever I went into the gynecologist and there is a IVF, so she had a fear of being examination during the vagina, and while examinations on the vagina, she had a spasm. So this was the history of case: right tubal block, lateral forehead injury, abscess behind ear in the childhood, typhoid, myopia has been removed by LASIK treatment, B12 deficiency, born in a village, weak in the study, fear of ghost. So this was the end of the case. Now, how to approach this case? Hope you all have the idea that this is the case. So what should we have to treat in this case? First and foremost things, the fallopian tube has to be treated, the psychosis has been treated. So in psychosis, there is an insecurity has been there. So in this case, what I have taken into consideration that she had a fear that the girl child has been taken as advantage and girl child has been taken as a rape or sometimes it is kidnap, but actually it is not happening. So this is what something that is fear is in the mind but not happening. So this is the fear which is mostly happen in this patient. So fear of misfortune, fear thought throughout the psychosis, absolutely the fearful remedy is there. Fear of misfortune means something other than that, but she has fixed fear that rape થાય છે, છોકરીઓનો બલાત્કાર થાય છે અને છોકરીઓને ઉપાડી જાય છે, kidnap થાય છે. That was the fear. So this is what very fixed in this. So again the process is what presumptuous can be one of the things, inconsolable can be one of the things. Yes. So if it is presumptuous right sided, so I must have a lycopodium is the remedy. Yes, fear injury will receive. So if injury will receive, there must be some tumor, but it is a blockage. Yes, it can be think of. Social positions and embarrassment can be one of the reason. Yes. Anything else? Soft with superior, hard with inferior, harmony, desire for aversion to same sex. The remedy can be lycopodium or natrum mure or pulsatilla. Yes. So what I thought in this case, partial prejudice. Yes. Very good. Think very logically. Not see what we have to treat here, the female genitals. So think like you are having a genitalia, and what was the fear that you might have blocked these things? Delirium frightful can be stramonium. Yes, we can think of. But stramonium can goes into spasm and again goes into yes, vaginismus is the entry. Yes, exactly, Dr. Raj. Perfect. Anything else? What can you think of? So why I do not allow to enter into it? This pareunia is the symptoms. Why I do not allow into it? So this is something that there is a fear. That fear may lead to the Spasm. There is the pathologies, fallopian tube and vaginitis and Bartholin's. Yes, these are the pathology. Absolutely, Dr. Rashmi. Delusion, abused. Actually, she is not abused, but she had a fix. We need to treat the. It is not a psychosyphilitic case, so I cannot take a delusions. It is a purely psychotic case. So fear is important. So my analysis is like this. Yes, anyone have tried last? Yes, fear of pain. Absolutely, one of the things you can think of. At every level, downward, up, she is restricting entry of the sperm. Yes, Dr. Rashmi. Absolutely. Then what is that? Fear of opposite sex. One of the things you can think of. Right-sided. Yes. Then problem with the husband. Fear, delusion from. The lycopodium is the only remedy. Fear, delusion from. Yes. Then yes. Stramonium can be one of the reasons. Yes. See, simple thinking, high living is the motto. So we will think very simple way. Embarrassment, yes, you all are thinking at the level of mind, but I am thinking at the level of physical also. Does not want to get pregnant. That is the reason why they are here. Natrum carb is the remedy. Yeah, you can think of any remedy. Tepesagria, yes, you can think of. Okay, so let's disclose fear of observing and watch. No, doctor. It is not related. Natrum mur, you can think of. So the rubric I took is like this. Fear, rape of being angry but cannot express. Yes, absolutely. Fear, rape of being vaginismus, coition during, and vagina painful, coition during. These are the three things which is physically is giving me a pure totality. On the basis of these three things, I got only one remedy, that is a creosote. She had a leukorrhea, but it's a creamy and not a very acrid type of. So I went to the carbons, and the carbon having a very timid, fearful kind of personality, talking disposed to, and everything. Along with that, carbon having actions on the tube, which is blocked. So UP1 is one of the carbons, very timid. She is angry but cannot express the anger. She can express the anger on child only, not on the elders. Okay, so this is what the feeling of the carbons, and here I do not take any delusions or anything out of it. Just I took a fear of being raped. Actually, the fear of being raped, that means what? Even when they are doing a sex, she feels that I do not allow. So she feels that it is the being husband is being raped on me. So this is what fear of being raped, and due to that, she had a spasm in the vagina, does not allow to enter the vagina. So this is something that is what I took as a reactions and the sensitivity of the fear of being raped. So both are taken and I prescribe UP 30. It is a carbon 30 weekly doses for 1 month, 3 months follow-up. Everything was normal. There is no pain during coitus, leukorrhea. There is no vaginismus. So everything again the same repeated remedy is given. And then she said that my sexual desire has been increased. So UPN 30 repeated for the 4 month, and then the USG report was done. Okay, again, yeah, absolutely. Whenever you can take a rubric female tubal disease chronic, the UPN is a single remedy. So on the basis of that only, because our medicine has to be act on physical as well as on the mind also. So that is what I prescribe. So on the basis of that, I prescribe Lupion, and this is the result. This is the result that bilateral patent fallopian tube after 4 months of treatment. Patient came to me in a June, and in the October everything was normal. So this is what, whenever you remove the cause, everything will be removed. So this, the previous report is like this: right-sided tubal block. This HSG shows that bilateral patent fallopian tube. So many a time don't go higher just to take a small things as an entry and treat the cause. So something that is you have to treat in the patient. What is the morbid phenomena happening at the level of body, and what is the morbid phenomena happening at the level of mind? So, so doses and repetition 30 potency weekly for 4 months. For repetitions, you can go through the pathology lecture of the previous question answer session. You will get the idea. Whenever there is a psychosis of the adynamic in nature, you must repeat 30 potency repetition. So this is what I am doing in my clinical practice, and you get the wonderful. I get the wonderful result. So same way, you also get the wonderful result in your case also. So hope you all enjoy this in sessions. So still we continue these sessions, or still we have another session next month. So I have a few more questions to finish this. So are you agree to continue the sessions, or we will finish right now? If your answer is yes, let me know in the chat box so that we will continue the sessions. Otherwise, we will take it next time. What counts if all are agree, we will continue. And again, I will upload this to YouTube so you will get the idea. Yeah. In azoospermia, if it is a blockage, then also you can think of upion, because upion is helping in the blockage. And if it is because of there is a testicular failure, then you go higher to understand the azoospermia. So in one case, three cases, I took one rubric from the male chapter, aspermatism, and on the basis of aspermatism plus disposition of the patient, I prescribe one case of calcarea iode, two cases of lycopodium with the best result. So in azoospermia, you can think of one rubric, aspermatism, and another is a tubal blockage. So that is what something you can think of upion in azoospermia also. Okay, but I have no any experience of upion in male patient, but in female patient, I have 4 5 cases with the upion, and that all are having a good result with the tubal blockage. Okay, so we will continue the sessions for more than 1 hour, more of 1 hour maybe. So these questions from Dr. Naresh Bavankule from Brahmapuri: how to probe a cause in the patients. So many a time you all are wondering how to take the history in the case and how to prove the cause. So this is what the a very broad question to be asked. So I am trying to give you the answer of these questions. So the most of time we need to find out the three type of the causes: the emotional causes, the physical causes, or the medicinal or a drug induced, or the vaccination as the cause. So this is what the case of whenever there is a case of the acute, you might find out all three cases. Whenever the case is a chronic, you might find the perception related to this emotional cause has to be find out in the case. So this was the questions. So medicinal or a drug induced or a vaccination cause. So I will share two cases of this. So one of the patient came to me during the whenever the lockdown, during the COVID time, the lockdown has been open up, and he was very insecure. So he one fine day he got the fever, and he came to me in the evening OPD with the fever. He was dull, hot, thirstless, and very insecure, and he has the fear that he might not get COVID. So because in that time there is very era of the COVID. So in that time, so I asked about what happened 3 days before, what happened one day before. So he said nothing. I am very secure, very insecure. So I need to take care of everything. Even he came with the mask, he came with the gloves in the hands and everything. He does not touch anyone, and he in his pocket he has a sanitizer. Okay, so this was the state he came to me. So I asked about what happened. So he said that 3 days back he went to the second took a second dose of the COVID vaccinations, and after that COVID vaccinations he got the fever. Okay, so on the basis of this, the fever after vaccinations and very, very cautious, insecure people, very, very fearful people, dull or thirstless, I prescribed Thuja to that patients. And the next day in the follow-up, he was absolutely normal, no fever, and everything is fine. So this is a simple case, but the cause is vaccinations. Another case which I am sharing already, I have shared this case in the clinical tips video in my YouTube channel. So in that case, what happened? One fine day, one of my old patient came with the complaint because he has the constipation, and he came to me with the complaint of diarrhea, and he had a diarrhea last night. Even last evening, the diarrhea started. Diarrhea watery. Then, previously, it is a semi-solid, then watery, and in the night time, he got a diarrhea with a bloody diarrhea. And the next day, he came to me with the pain in abdomen, very colic, and a bloody diarrhea. So I asked about what happened, what you have eaten something outside or not. He said nothing, 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 everything was fine. So I asked 4 days before what happened. So he said that 4 days before he had a constipation. So he took Indrayand, a very vegetable laxative, which is he had took. So he took Indrayand, and after taking Indrayand, he developed diarrhea, and after that he developed a bloody diarrhea. So this was the case. So I don't understand what is intent. So I Google the intent and find out that it is something that the remedy which is prepared from the colosynthesis, a cucurbitaceae family, the vegetable substance which is used for the constipations, and it is a vegetable laxative. So on the basis of that, I prescribe on the basis of that abuse of vegetable medicament, Ayurvedic vegetable medicament, and I prescribe Nux vomica to that patient. And within no time, at the evening, he stopped the diarrhea, bloody diarrhea stopped, and the normal stool has been passed, no pain and colic. So this is the two cases which gives you that sometime in an acute condition, you might find that the medicinals or drug or vaccination can cause a disease, and that has to be taken into considerations. The another point that the physical cause, most of time you get the physical cause is because of the exposure to heat and cold, or sometimes the physical trauma. So right now in the day, right now this day, the days are hot and nights are the cold. So most of time in that type, exposure to heat causes certain disorders, and person may become dull and everything. So in that cases, you can prescribe according to that cause, and the acute chart has to be taken into considerations. Again, I will share another two cases of the physical trauma which I get. So one of the case of the lady working in the kitchens. One fine day, he work to take something from the what we call as a shelf from the above. So she rise to the platform and she takes something from the shelf. Suddenly, she fall from the platform, kitchen platform, and fall on the black back. So she came to come clinic. She said that there is a backache and backache due to the front. But I asked what happened then. What happened then? She said that since there is a history backache, I do not have pass tool for 3 days. So this is what something you can find out. So I took the rubric constipation injury rectum with, and on the basis of that, the arnica was the prescribed, and the next day she had a reduced back pain and she passed the stool. So this is what something the physical trauma can lead to the remedy. Another case of one of my assistant doctors, Nana was admitted in the hospital, and she called me that Nana has road traffic accident, and after road traffic accident, he had a chest injury. There is a rib fractures and injury to the chest, and it may lead to the pneumothorax and he was admitted in the ICU. So she sent me the photographs and everything. On the basis of that, I just look at the repertory, and in the repertory, I found that pneumothorax injury. After I advised to give arnica 1 m 1 hourly, and the next day he was absolutely fine. The pneumothorax was reducing, and the doctor says it is a miracle with the ICU patient. So he is absolutely comfortable. So arnica can be one of the physical trauma remedy. The emotional causes, for that emotional causes, you need to find out the emotional causes according to the ages, infants, school-going children, college student, middle-age, working or old-age people. So for that, there are the causes which is related to the infant. So most common causes in an infant are the vaccinations, but sometimes you need to understand what was the situation happening during the infant stage up to 2 years, so that you, in that case, you need to find out the certain causes. Say for example, mother is being used to work, and after 3 4 months she used to have a resume office. So the separation anxiety has been started in the children. Child was kept away from mother because of mother falls sick, fight between the parents. Even the small child can understand the fight and the love of the parents. Mother being beaten during this time, or interruption in the feed also can lead to the emotional causes. Might be angry. The child was frightened by seeing dogs, cat, or darkness, or sometimes child may frightened by the noise. Sudden noise of the vessels falls in the kitchens, and sometimes sudden noise of the what we call the whistles of the cooker. So sometimes the child got frightened, or sometimes the child may fall or hit by the mothers due to irritable child, or newborn sibling in the house. The another 2 years child and another baby comes into home. So also there is an emotional cause happening in the infant. So you need to probe this situation into family. At a school going children, you need to probe about the punishment in the school, losing rank in the class, disturbances from the friends, humiliation in the class, parents' strictness, parents' quarrel, missing working parents, or failing in the study, sport activity failure. Sometimes you might find that teacher has advised that you need to play in the school games, and suddenly that child was kept aside, and another child was taken as the playing inside. So that child feel that the losing of his positions also. So sometimes the sport activity can lead to the this process disappointment, or in the children, or very young children, there is a sexual abuse also. So these are the causes to be find out from the school going children. In college student, you need to find out any problem with the friends and peers. There is a infatuations or a crush or with the opposite sex and everything. There is a disappointment in the love. There is a failure in the study, and sometimes the complex about the money and the status. So one friend is very poor and one friend is very high status, so that may lead to the complex. Even there is the abuse, use of the bad words for the bad purpose, or a treat with the cruelty or violence or assault sexuality. So that has to be find out from the college student, and that has to be taken into consideration. So these are the emotional cause can lead to the abuse, anger, and everything, or sometimes anger suppressed, or sometimes disappointment in the love. Another common causes, which is emotional causes related to the middle age or working age, there may be the financial embarrassment, the social embarrassment, or a working problem. There must be injustice in the work. So this is what we call as the corporate politics that lead to the problem. So this is injustice or sometimes abuse, family disharmonies, or person having some extramarital affairs. So this is something you have to find out in middle-aged or working age people, or sometimes the loss of ambitions or loss of money. And emotional causes in the old age because of retirement, neglected feeling, or insult, or uselessness feeling, or monetary tensions of relating to the money or the currency. So this has to be, so the cause has to be probed at this level, different way and different situations. And from that situation, you will get the reactions and the sensitivity of the persons, and then take into consideration as the entry point. But again, if you got this cause, you need to understand the miasm. What are the miasm has to be there. So if it is the storic disease, you need to treat the storic cause and you need to apply the storic. So that is what the storic stage is. The storic causes is sensitive to disturbances. So it may lead to the reaction like irritability, anger, anxiety, worry, anticipations, hurt, mild grief, or a transient fear or transient anger. So there must be sensitive to rudeness, sensitive to criticism, sensitive to neglect, sensitive to external impression, sensitive to disharmony and quarrel at home, sensitive to joy, sensitive to light, noise, music, order, touch, or pain. These are the pure psoric cases, mostly in the psoric causes. A psoric cases you can take it as a psoric cause. Whenever the cause has been a psychotic, so it is a slow, stressful, and prolonged causes. It is sensitive to stress. So most of time, the prolonged grief, vexations, stress related to the work, business, and everything, and the insecurity and the fear has to be find out. So there must be some brooding and disappointment in love 10 years back, but still he is a brooder. So this is something the psychotic cause is going on. Anger suppressed, mortification, grief from the loss of money, loss of position, or from loss of loved one. There is a grief from the business cares or the house cares, or anger suppressed from this. So this has to be taken as a psychotic cause in a psychotic cases. Or the syphilitic cause is when the disease is of destructive in nature, a sudden and strong and violent. So mostly the sudden, strong, violent emotion has to be taken into consideration. The sudden joy, sudden loss of loved one, sudden loss of business, money or prestige, or shock, insult or humiliation, abuse, sudden fright and panic, sudden anger, rage, wounded honor. So these are the few causes has to be taken into consideration when the disease is syphilitic in nature. And in syphilitic cases, physical trauma is the most important. Even the drug and suppressions are the most important. So I had given you an idea that in the case of pneumothorax, the cause is a physical trauma. So that has to be taken into consideration. So this is the syphilitic cases. So hope you got the how to probe the cause in each and every cases and everything. This was the questions by Dr. Suresh Kalburgi from Patan, Maharashtra. After repatriations, the Lectin remedy came. I don't have Lectin. Do what on the paper, Lectin 1 m with SL 2 gram, and ask the patient to keep that paper in with her. After that, her complaint reduced for the 3 days, and she done some ritual with a taviz, and again her hysterical convulsion, diarrhea, headache increase. And again, I don't have Lectin. Do write Lectin 10 m on paper and ask to keep with her. After 20 days, patient in her life says that she is free from convulsion for 20 days. After 20 years, for first time, I have not given her Lectin, but she is better with those written on paper. Should I give her medicine or wait and watch? What was the answer to the questions? What do you think? Dr. Suresh is with us. What you think of? Again, you have to understand what was the patient presentations and what is that as a miasmatically. Yes, wait and watch. Dr. Poshan Rawat has answered. Absolutely good. Anyone? Wait and watch. Yes. If physiological cases are there, may not give a dose. Conceptual dynamics. Absolutely. Then what? Dr. Suvarna. Conceptual dynamics, but what? Do we repeat the dose or do we? Okay, fine. So everyone has idea that what to do. So as per Sir's teaching, the writing the name of the medicine on cheat will work in a psoric or a psoriasis cases of not of too violent character. Keep in mind everything that is sometime it is the yes. If it is physiological, no need to repeat. If pathological, write on paper is not sufficient. Absolutely, Dr. Amar. So the same thing what I am going to give you answer is writing the name of medicine on cheat will work in psoric or psoriasis cases of not of too violent character. So if your medicine work in this case and patient is better, then sir always says be a third empire and wait and watch. Our medicine is just to stimulate the nutritional gradient of the patient. Rest patient will be cured by the himself. So if the physiology has been maintained or homeostasis is maintained, no need to stimulate the organism again and again and again. If the pathology is there, you need to give a medicine in terms of physical form, or you need to give a what we called as a oral or what we called as a local dose so that you can get stimulations. So again, our medicine is just to stimulate the nutritional gradient of the patient, and rest patient will be cured by himself. So that is what the answer is. Hope Dr. Suresh Kalburgi sir, you can get your answer that you need not to be, because again the hysterical presentations or convulsion of the hysterical, it can be a physiological in nature and it is absolutely normal. Okay. So it can become normal because of the circumstances has been changes. So this is what something you need to understand. So in that case, no need to prescribe. Dr. Shiny Alex from Bangalore, she asks, can we repeat the dose of medicine in autoimmune cases? If so, when? So very important aspect of I have shared the case. Again, in autoimmune cases, what I usually prescribe a higher potency 10 m and 50 m with the weekly or fortnightly repetition till autoimmune marker gets normal. One thing has to be taken into considerations. Second, so I will share with you a report of scleroderma cases here with you. So in this case, what I got is something called as the a case of a scleroderma of a 41-year female having ANA profile was positive. Hope you got a visible screen. Report screen is visible to all of you. Yeah, you can use dilute dose also, but I generally prescribe the single dose weekly, not dilutions, direct doses. Okay, so case is visible. This was the case of December 2023, and hemoglobin was 10.5, platelet was 4,31,000. Okay, ESR was 60, and her ANA profile is like this. This is the 2nd December 2023. So all antibody were negative. Only one antibody, which is this one, is positive. Okay, this is 19, very high, and the SCL70 antibody suggests that it is a scleroderma. It was in a 2nd December. So on the basis of the whole history of the patient and the sensitivity, and I took the rubric induration connective tissue indurations general, and one of the sensitivity of the patients in the childhood is sensitive to criticism is there, and syphilitic reactions after this is aversion to milk. So I took very simple rubric in this case, not anything out of it, and I prescribed the remedy, simple remedy, calcarea carb. After the 3 months, 4 months, his HB was rising to 11.1. Previously, it was 10.5, and the platelet was within normal limit. Neutrophil was absolutely normal, and ESR is little bit higher, but it is a historic one. Okay, and I advised the autoimmune marker. So autoimmune marker, which was done previously in December, it is on the 4th March. So after 3 months, the SCL antibody become absolutely normal within the repeated doses of calcarea carb 10 m weekly. Okay, so this is what my clinical experience which I got that, and the patient was clinically better. There is everything was normal. Skin become, previously she had a face skin was very tight, so it become normal and plumpy and soft, and she had a joint pain and everything. So that joint pain has also reduced to such an extent. She had a mild pain, but it is something. So here ESR is raised because there is a inflammatory changes is going on, but it is not autoimmune. So now the autoimmunity gets reversed into it. So that is why I took this SCL70. Again, this calcarea carb is many a time I found another understanding in autoimmunity. Many a time I found that the same remedy can be autoimmune and same remedy can be a GCS also. So whenever the autoimmunity has been reversed, then you need to do another process. So you need to stimulate the genetics by prescribing a 200 potency. So this is what another experiment which I am doing in my patient also. So in autoimmunity, higher potency, when autoimmunity gets reversed and normal, then the potency could be the 200. So the remedy which I prescribe to this, still I am giving her 10 m potency, and next month my plan of treatment is by looking at follow-up. I just prescribe the same remedy in a 200 potency, so she might not land again into this autoimmune process. The rubric I took was sensitive to criticism. I will show you that rubric. Very easy rubric. I will show you. I will open the Kara and will show you the rubric so that you will get the idea that how I took very simple rubric and prescribe the remedy. So it is not difficult to practice homeopathy, but it is what you have to understand the patient in a, such a easy and a natural sense so that you can get very easy remedy and easy prescription. Sometimes what we are fascinated by the delusional and delirium rubric, but it is not like that. Sometimes sir always says that homeopathy is very easy. So if it is easy, then the prescription and applicability is also easy. Okay, so this is what I am doing in my clinical practice is easy practice, not a very difficult or different practice. Understand the man in a simple form. So if you understand the man, you will get the idea and you will get the remedy very easily. So my Kara is opening, so I will show you that the rubrics. So I took only simple rubric. In that case, I didn't take any autoimmune rubric from the patient, but I took the sensitivity of the patient because this sensitivity helped me to get the constitutions. Okay, my Kara is taking a longer time to open up. Yes, now it is opening. Okay, so I will share with you the repertorization chart of that patient. Hope you have a visible Kara screen. Yeah. Okay. Fine. So this was the simple rubric. I combined two rubric. One is induration connective tissue plus inflammation of connective tissue. I combined these two rubric into one rubric. Then I took the sensitivity, sensitive to rudeness, and another is food and drinks, milk aversion. So on the basis of that, I only get one remedy, and that is calcarea carb, and I prescribe how to ask aversion. तो पेशेंट बताएगा अब अपने आप से आपको पूछना है कि आपको क्या अच्छा लगता है क्या अच्छा नहीं लगता है यस 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 यू कैन आई डोंट लाइक मिल्क इट्स अ फिजिकल जनरल सिंपल I don't drink milk. Even milk may cause nausea, milk may cause vomiting. Even the smell of milk cannot tolerable. So it is something which is aversion. Okay, very simple. It's a physical general. So in that case, I prescribe. Yeah, patient when the yes, absolutely, Dr. Nisha. See the reaction and expression of the face when answering. So if the patient face expression is very disgusting while telling the milk, na, then also it is a aversion. So this is what something I experience. So in autoimmune cases, I must have repeat the remedy in a higher potency, and uh, after that the autoimmune marker gets normal. So the another prescription which I thought was I prescribing the 200 potency to same. So in that case, two things has to be taken into consideration. Yeah, yes, absolutely, Dr. Priyanka. But this is what something that I am luckily in this case I got the very simple rubric and the result with the without syphilitic rubric. But the sensitivity to rudeness is a syphilitic in patient. But we thought it is a soric. Okay. So that is what we have to taken into considerations. So many a time after autoimmunity, you will get the patient becomes so much so sensitive to certain things, and that certain things has to be taken into consideration. That is the intensity of the patient. And sometimes it is a small rubric that help you to crack the case like the autoimmune cases. So many a time you will get the answer. So homeopathy made easy. This is what I actually perceive in this case. Okay. See, what sir always says that our understanding of evolutionary process is the our evolutionary process is of something which we call as we have to evolve gradually. But again, when we have evolved to certain extent, we not forget our basis. So when the base is there, our evolution is good. If we forget the base, we are in the air and we will not get what we want. So this is what I am doing in this my cases, that I am sticking to the base and also evolving in such a extent so that I can get this simple result with a simple rubric in autoimmune cases also. Hope you got the things. Yes, common sensitivity. Yeah, absolutely. The great things has to be taken. Sensitivity goes into the autoimmunity, na? So we have to take into considerations. Yes, you can repeat. I had one of my assistant doctor is practicing there. He had the 3, 4 cases of autoimmunity, anti-TPO reversal, and he had prescribed repetitions, higher potency. Yes, Dr. Ajay, you can repeat. Another case of Dr. Suvarna Chavan from Jarna. Question is how to proceed in SLE cases, systemic lupus, when should repeat the medicine and what potency. Now, do I need to answer the questions of this case? Yes, sensitivity is there. You can take into that into considerations. Dr. Suvarna, do I need to answer these questions? Yes, everything is self-explanatory. Since morning, we are dealing with the autoimmunity and repetitions and the doses and everything. Do I need to answer the question or you get the answer? Yeah. Okay, fine. So this is what something that everything is self-explanatory. Already find out the potency, find out the autoimmunity, repetitions 10 m or 50 m weekly or fortnightly, and the answer is like this. Dr. Amar is with us, and uh, he has asked the question, sir, please give a tips and what to ask and observe in infant and how to probe thermals in infant. And sir, please do a session on physiognomy and organ and emotions. So uh, already I have answered the cases of infant, how to probe a cause in infant and everything. And Dr. Sunita will take that this is a genetic mutations, and later on how to approach the cases of agenesis of organs. Okay, I had one case of infantile uterus, and I had prescribed that medicine, but she didn't have menstruate till now. But organ has raised the size that I have made that. But completely I didn't get the menses in that lady, and she lost left the treatment after the 2 years of the span of my treatment. After that, she didn't
तो
came.
चुभे तो चुभ जाए कोई चीज तो थोड़ा लिक्विड हुई
So that has to be on a different
सर
part of different learnings of organ agenesis.
चलिए भाई
Mostly in cases of
उसी का तो
regeneration,
महंगी मिल
sir
रही है वही
always says
खाना में नाश्ता कर ही रहे हैं उससे ज्यादा अपन वहां से परिवर्तन होकर आ भी नहीं सकते
mostly in cases of organ regeneration, you need to prescribe a 200 potency and no repetition till 3, 4 months. This is what I learned from sir. 2 minutes. Dr. Amar say this answer is this. Kindly refer my video of case taking on pediatric already uploaded in YouTube channel. So in that case, you will get the answer to everything, how to observe the infant and how to get the history from the infant and everything. Still, I am not using physiognomy of the patient in my prescription, so I am not going to go into detail of the physiognomy. And for organ and emotions, you can go through the GNM for just learning purpose, not exactly everything to be applied in that case. Okay. So hope everything will be fine and you all learn. So we will end our sessions. And this is what I learned from my practice that We'll take dengue later. It is a sorosyphilitic disorders. So this is what I learned from my process. So learning is not process of copying from somewhere else and pasting somewhere else. Learning is process of experiencing someone experience in our own perspective. This is what I learned in my 10 years or 15 years of session from Dr. Vijay sir. So this is what you have to learn from this. And thank you so much. Thank you all for being with us in this journey of learning. And I will upload this session to YouTube, so you will get the YouTube link in the group, and everything will be for your knowledge. So thank you so much. Thank you all. Next month, at the end of next month, we will again take a question answer session. So I will send you a link of question answer in a group. So you will fulfill the questions, fill that Google form and ask the questions. And in the next month, at the end of next month, we will continue our learning. From tomorrow mornings, we will starting with the session on the theory of acute books reading. So from tomorrow morning, we will starting with the new book reading, Theory of Acute from Dr. Vijay Sir's bookshelf, and some practical points related to the acutes. So I will generate a new link and I will share that link to the group. So you can join from tomorrow morning, daily morning, 7 to 8. We will have a reading sessions. So we will start from this tomorrow morning. Thank you all. Thank you being with us, and thank you learning and evolving with us. Thank you so much. See you tomorrow all at 7 a.m. Thank you all. So we conclude the day today. Thank you so much.